for Dr. Natasha Das, I would want to tell you that I was, I had kind of, I'm a sucker for people who write and who teach, others to write well on, of course, scientific writing. Also the other, but I'm right now talking about scientific writing. So, ma'am is quite a prominent figure on LinkedIn. If you now start following her, you would know that she is all over on LinkedIn. And when I asked, AI about top five scientific writers of the country, ma'am's name showed up. I did not reveal that, but last night I kept it for this morning. So I was asking how you found me. So I did not tell her about the top 5 thing. But that is how AI cropped up. Your name was at the number 1. So we are looking forward to this lecture, ma'am, and we are very excited to hear what. See, we have attended a lot of medical writing workshops, but like I told you, that you can never have enough of it because you never are an expert on it, even after years of doing it. So I'm sure that you'll have a lot of learning to do. And okay, ma'am.
You continue.
Yeah. So I'll just hand over to Dr. Pal. Yeah, you can just speak about it.
Good morning, everyone. Please welcome Dr. Natasha Das. She is a healthcare communicator and a medical writer. She has 28 years of experience in healthcare communication. Please welcome Dr. Natasha Das. Over to you, ma'am.
Mike.
Good morning. Am I loud enough to the last bench also?
Without the mic?
Yeah, without the mic.
But
Good.
we would like it with the mic because it's going
Okay, on
live streaming
YouTube.
also.
Okay, yes. Thank you. And is it audible now? Clearer? Okay, thank you. Thank you, Dr. Harleen, for finding me. And with a lot of humility, I would like to say that when I started off as a medical writer, I was not aware that there is opportunity for this. Right? I started off with just proofreading somebody's handbooks, a publisher's handbook. They wanted me to proofread it. I proofread it because I was just sitting idle at home with a small toddler in tow. But they came back with a check. And that's when I realized that yes, I can earn from my knowledge of medicine and my skill of writing or understanding how to write. Right? That's how it started. I was pretty early in the sense that I started off with a website. We are going to talk about visibility today, that's why I'm bringing this up. I started off very early with a website. I had a website way back in 2004 or 5, I think, or maybe earlier than that. And that's how I got most of my international business. Because researchers in US or Europe, when they look for medical writing help, they are going to look at countries which are cost effective for them, right? But how do they search? If they reach out to researchers mostly do their own writing, right? But I created my website and that's how I got a lot of projects. Now this is a little bit about where I stand now. Now I am an editorial board member of one of the Indian Journal of Medical Sciences, and then I am a member of the Medical Writing Council for Indian Society for Clinical Research, being there for a long time, and we started our workshops pretty early with ISCR. We still conduct a lot of medical writing workshops. And we are into the 20th annual conference this year. I mean, this year will be, not this year, this was the 19th, next year is the 20th, and we are already planning that. Right? And, okay, so the disclosure here, I am not a homeopath, so what I talk about today may be out of context for many of you, but if I go out of context, please bring me back and let me know where I go wrong. And some examples here on homeopathy are taken from ChatGPT. When you were asked whether we use ChatGPT, I definitely do. Right? Do I depend on it for writing? Not much. I use it more for actually idea generation. Right? And if any of the examples are out of context, bring me back. And there are some publications here which I have used from some of your publications, people sitting here. Right? If you have any objections to my using these publications in this presentation, please let me know.
Go ahead.
Of course, there's one
If
from
it's
your.
if it's for the right reason, and you'll just make us popular, so no worries.
Yeah. So we know that homeopathy is pretty popular, right? But there is also this thing. Where is the science about homeopathy? Right? This feeling is also there. So what I'm trying to say is, as homeopaths, you need to increase a lot of homeopathic publications, because that will reduce the misinformation people might have about homeopathy and improve the awareness, drug proving for your work, and then it will increase global collaborations. If you are doing something in homeopathy here and you are published, somebody else from another country would want to collaborate with you and do more multi-centric, country collaborations for research work. And of course, we talked about patient outcomes, empowering clinicians, and also changing global policies for homeopathy, right? And on an individual level, how does it help you? Of course, it helps advance homeopathy knowledge for you, because when you write, you also read a lot. Right? It increases your own homeopathy knowledge, builds your professional reputation, and you feel that you are contributing to evidence-based medicine, right? And promotes career growth or not, I don't know about you, but for medical professionals, for medicine, it does help in professional growth, because your promotions are based on your publications, right? And also you feel nice that you are driving innovations in your field, right? But it's not enough to just publish. What else do you need to do? You need to understand why so many papers get ignored. Every year there are millions of papers, at least in medicine, which are being published. But not every paper is read enough, right? How many of you have published homeopathy papers? All, right? Okay, there might be some MOs who are not into publications, but most of the ROs are into publication, right? How many of you have received more than 10 citations? Okay, there are a few. This number decreases, of course, right? The number of publications is fewer, much more than number of citations you receive. Right? What does impact in research paper mean, right? It means the number of citations on an individual level. But it also means whether you are able to change the clinical practice. You are able to, change the policy of the government. And also involve the public in the kind of research you do. So what impact means to you might differ from what impact means to me, right? I might be looking at more number of citations, you might be looking at changing the practice. Okay? So impact is a formula that I thought of. I actually asked ChatGPT to derive this formula for me. I asked ChatGPT what can be a good formula for impact. This is what it gave me: credibility into visibility and into relevance. Right? So you have a highly promoted research work which gets seen, but it's not credible enough. People don't trust it. So your credibility becomes zero, which is why your impact will also become zero, because it will not be used so much. Though it will be read, it will not be used in actual practice. Visibility. Now again, visibility means you have a great research, but published in a journal that is hardly ever read. Right? So there also it becomes zero, impact becomes zero. Right? You have a good paper, good science, but it is not relevant to the clinical context. Right? It is good science. You may be talking about the number of homeopathy publications, maybe. You have a research on bibliography of homeopathy, but it's not relevant to practice. then again your impact is zero. It's not being used. Basically, impact means it has to be used somewhere, not just be visible, right? But we can increase the impact by increasing these credibility, visibility, and relevance. Right? So for let me tell you that we don't find credibility, visibility, and impact being accidental. It is always designed. So we actually have workshops on publication strategies, right? How to strategize your publication. You have to choose a research topic and design that is relevant to your field. Choose relevant questions and questions which are answerable, align with the clinical gaps and controversies of or ongoing debates at that time. Design the paper for publicity and usability. Write in a way that it is actually used. Right? Now for choosing a relevant answerable question, right? There is a kind of a acronym used for that. Anybody heard of it? Definer? Yeah? So FINER means, let's have it from the audience. FS, the question should, the research should be feasible, right? With the fund that you have, with the human resources that you have, with the lab resources that you have, you should be able to conduct that research, right? Then I is interesting. Yeah? Can we have the mic go around? It would be good to have some discussion. I'm hearing the answers, but maybe.
Mic.
Yeah.
Dr. Santosh, we would need somebody from the admin team, please. Somebody from the admin team to take, yeah, sure. I can see you.
So I is interest.
Get a mic, please.
Interesting to whom? Interesting for whom? To the readers? For yourself first. If it is not interesting to you, just because it's part of your thesis paper, you want to write a thesis, you have to publish something within 2 years, so you need to write something. Don't do that. Find a topic that is interesting to you. Only if it is interesting, you will dig into the literature, you will do the amount of research that is required, you will do it in a strategic way that it is actually credible research, right? Unless it is interesting to you, you will not. And N is? Novel, yeah. So something that is new in your field, right? It is actually either debating that is already there, or actually strengthening the evidence that is already there. Not always debating, it could strengthen the evidence that is there, right? So it gives a new perspective to the knowledge that is there, right? E is ethical, right? So it should be conducted in a way that is ethical. We will come to ethics later, so I'm not discussing that now. And R is relevant to whom? Relevant in what manner?
It should be applicable.
It is relevant to the public in the end, but relevant to the policymakers, relevant to the time and trends of that time, right? If I go and do a research today to say, which organism is prevalent in patients with tuberculosis, it's not going to help the world. It is not relevant. You might do it in an ethical way, you might do it it might be of interest to you, it might be a feasible research, but it's not relevant at all. Today you don't want to know, which bacteria causes tuberculosis. We don't want to know that, right? This is the hierarchy of evidence that was discussed yesterday also. In case anybody has a question on this, we will discuss a little bit on this, otherwise we'll move forward. We can move forward, right? So, at the basic level, if you want to publish, you can write opinion pieces if you are, an expert in that field, without conducting a patient research, right? And the difference between case reports and case series, yesterday we did not discuss how many patients is a case series. It depends on the journal where you are publishing. Some journals say any more than one case is a case series. Some journals say 1 to 10. So if you have more than 10 case series, don't present it as a case series. Right? It goes as a cohort or case control, maybe cohort study, but not as a case series. So it depends on the journal. Right? Basic thing is, if one case, it is a case report. If more number of cases, it's a case series. Right? Then at the highest level of evidence, the systematic review. Systematic review is a review of research that has already been conducted. Some terminologies when we talk about ethics: instructions and recommendations. What is the difference? You must have heard about instructions to authors found in journals, right? On the other side, you might have heard about the ICMJE recommendations, or the International Committee of Medical Journal Editors. They have recommendations. So there is a difference between instructions and recommendations. When you go to a journal and you see an instruction to authors, these are instructions you have to follow. If you do not follow those instructions, the journal might reject your paper or might return it back for revision. But when it is a recommendation, this is a recommendation that that group, ICMJE group, suggests that this is the way biomedical research papers should be written. Not that that's a hard and fast rule, but that's a recommendation that many journals across the world follow. Earlier, ICMJE on their website used to write that around 700 journals follow their recommendations, but now they have said we will not say that any journal follows our recommendation. We will not write the names of journals which follow our recommendations. It is up to the journal to decide whether they want to follow these recommendations or not. Three other terminologies that we need to understand before we go to ethics: laws, morals, and ethics. What are laws?
Something that is right by, something that is made by the governing body.
Yes. So laws or regulations are something that are made by the governing body. Laws are made by the state. Regulations are made by the governing bodies. I am not sure if CCRH has regulations, but ICMR does have regulations. So there are, you have to abide by those laws and bylaws and regulations, right? Now, what is ethics and what is morality? We had discussions about that yesterday. So, anyone who wants to talk about the difference between ethics and morality?
Maybe a statement from you would help.
Yeah?
You can explain a little.
Okay.
There is a difference.
There is definitely a difference. So morality is something on a personal level. It is your own moral values. You don't want to lie. You want to be truthful, right? Or you follow certain rules that you have set for yourself. That is morality. But ethics is more like a community. Ethics is a group of, guidelines that a community sets for themselves. Like in a temple, we do not wear footwear, but you can wear a footwear into the church, right? So it is that community which has set that rule, right? So similarly, ethics for medical publication is something that is set by the medical editors, by the medical researchers. So that is ethics for them. Right? But morality is on a very personal level. You decide, okay, I want to do this and feel good about it. Right? Who decides what is good or what is not good? Who decides what is right? There are certain agencies. WAME is the World Association of Medical Editors. Then there is the Council of Science Editors, which is for all science-related publications. Then this is the International Committee of Medical Journal Editors that most of us follow in medical publications. When there is a company-sponsored research, right? If a pharma company is sponsoring the research, what we as medical writers follow is called the good publication practice. Good publication practice gives a guideline on what the writer should write, what disclosures they should make if it is a company-sponsored research. Whether somebody from the sponsor company can be an author or not be an author. All these are in the good publication practice guidelines. Then there is the COPE committee, which is the Committee of Publication Ethics. As journal editors, if you face a dilemma, ethical dilemma, you can write to COPE. It's a community which discusses certain cases. So, or you may search for similar cases and you can find cases there at the COPE website. Some journals mention that they follow the COPE guidelines. So COPE actually does not have a set guideline. It is a group of medical editors who discuss publication ethics. Then there is, of course, the DHR policy on publication, which you may be familiar with, right? This is Indian, right? So Indian Journal of Research in Homoeopathy, that's your journal. They have the instruction to authors that you need to follow if you want to write to them, right? Then the ICMR publishing policy on research integrity and publication ethics. These are guidelines that you can use. Now, guidelines and checklists that you can use when you are writing your paper. Equator Network, the website is equator-network.org. If you go to that website, you will find it has around 700 checklists for different types of studies. So depending on the type of study you are publishing, you can decide, okay, I am writing a randomized controlled trial report, so I will follow the consort. I am writing a case report, I will follow the case care guidelines, right? Checklist. Or if you are writing a clinical practice guideline, you would follow the AGRI checklist. So there is a list of checklists that you can search there. Okay. In ethics, one important thing we discussed yesterday also was about consent. Procuring consent. If you are writing a case report, you need to procure the consent of the patient. Suppose your patient has died when you write the paper. How do you procure the consent? What do you do in such a case? Any suggestions?
Family members.
Yes, next of kin, right? Whoever, maybe the parent, maybe somebody else in the family who has been caring for them can give you a consent that you can publish, right? Even if you have consent from the patient or anybody from the patient's family, you need to still anonymize the patient's details. So the patient should not be identified by what you write, right? Then for larger studies, you go to the institutional review board, right? Or the ethics committees of your institutes. They will decide, depending on your protocol, whether this study can be done or not and whether you can publish it or not. So in your letter to the ethics committee, you must mention that you plan to publish it. At the same time, you can get the permission for conducting the research as well as publishing the research. Because some journals ask you to submit the ethics committee report also. What did they say? What was their feedback? Then consent for acknowledgements. This was not being required earlier, but today you need to get consents for acknowledging people in the acknowledgement section also. So some journals have started asking for written permissions from the people who are mentioned in the acknowledgement. This is because there were some cases where there were people who were mentioned as contributors, but then they said, we have nothing to do with that paper. Right? If it was retracted later or there was some falsification of data or anything, they said, no, we have nothing to do with this paper. Right? So, editors are now saying that if you want to write acknowledgements, seek permission. It's always good to have a written permission with you. Written does not mean a signed document. You can have an email communication also.
No, but there's you also need to mention, like you do in patient's case.
Do we need to mention that in the paper as well, that this consent from contributors were taken from
some journals ask for it, not all. Some journals, not all. But in the acknowledgement section, especially for us for professional medical writers, some journals like I think CHEST from SCCP, that is asking for submission of an acknowledgement from the people who are contributing to it. Right? So the only thing required is an email communication, that is sufficient. Or a signed document is very good, but an email communication also, if you can share with the editor, they are happy with it. But this is a newer thing. It was not required always. Authorship issues, these are familiar terms. So what is a gift author or an honorary author or a guest author?
When you actually you're the head of the institute as an author, just what sir was discussing yesterday, so we are doing that based on gift authorship.
Yes.
So that's that.
So you're head of the department, you want to name him as an author. Who benefits from it? The head does, yes, because he gets a publication. Do the other co-authors benefit? Of course they do. They do, because you have a senior author's name mentioned there, right? You do. But ideally, ethically, you should not include the name of any person who has not contributed substantially. So there are some institutes which have already said that, their HODs ask not to be named. Because once you are named, you are accountable for each part of the manuscript. Right? You cannot say, I just looked at the writing, I don't know about the data, I just saw what was written and I thought it was fine. No, you cannot think it was fine, you have to be accountable for the data also. So if the, HOD or your guide has contributed significantly, please do name them. Don't take them out. But if they have not contributed, they are tagged as authors or honorary authors. Guest authors who do nothing, don't even look at the paper, but their names are there. Right? It's not a gift that you have given them, they asked to be named. They said, can you just write my name also as an author? And you oblige by giving them. What's a ghost author? Writes but is not named as an author, right? Not writes but contributes substantially. Now ghost writer is somebody who writes the draft but is not named, right? Now, does writing become substantial contribution? Depending on the type of study.
Yes, because a person who is performing some basic experiment, I think then he's still he is an author. He's
right.
Not if he's not writing, but he conducted that basic experiment.
Yes.
So he is there as an author.
Yes. So substantial contributors are authors, but writers, just by writing the draft, you do not become an author. Like I may have written hundreds of papers, but I am not an author on hundreds of papers because I am being paid to write it. I work as a professional writer for those papers. So there is a difference between ghost writer and a professional medical writer. Ghost writer is a writer who has written but not named. Professional writer is a writer who has written and is acknowledged as a writer. In the acknowledgement section or in the contributor section, their name is mentioned that they have been hired by such and such people to write the article. So you are being transparent. Basically in research you need to be transparent. That's the only thing you need to remember about ethics, that you are being transparent. Right? Whatever you have done, you are mentioning. Right? Now, who qualifies as an author? According to the ICM JE guidelines is what we follow. So there are 4 criteria. Anybody who wants to talk about the first criteria? What's the first criteria for ICM JE authorship guideline? Conceptualization and? Yes, conception and design of the study. Right? Contributed to the concept or the study design. Right? Or even conduct of the study also. Conduct of the study also. That's the first criteria. Second criteria is data. Things to do with the data. First is to do with the study part. Concept and design and conduct. Second is the data. Data collection. Data recording. Data management. Data analysis. Right? Archival, everything. Right? And the third is manuscript writing, but not all authors write the manuscript. They should either write or review and edit. right? And agree with what is written. So you need to review also, even if you have not written the manuscript. You may not review the first few versions, you may review only the final version, but you need to review the manuscript. What goes into publication must be reviewed by each and every author, right? And what's the fourth criteria? That's a new addition. Fourth criteria is a new addition. I think 2020 is when they added, or 2021 is when they added. Maybe sometime, or maybe 2018. I don't remember, but it was a new addition. So the final criteria is accountability. Each author is accountable for each section of the manuscript, even if they have not contributed to that section. How can they be accountable if they have not contributed to the section? Like, I have not contributed to the concept and design of the study, then how can I be accountable?
So you were ultimately part of the team. So
Yes, so you should be, if there is a question, you should be able to identify the person who can answer the question. Basically, you should be able to answer any questions that are raised around about that study. You cannot say that I don't know about this part of the study. You may not have done that part, but you should be able to identify the person who can answer that question, right, in that team. And substantial contribution basically means you should not be contributing to just 1, 2, or 3 parts of the points that I mentioned. All the 4 criteria you should fulfill to be able to be named as an author. Otherwise, your name can be published as a contributor. You do qualify as a contributor. Now, what is the role of professional medical writers? Why would you need a professional medical writer? First thing is, you may not have the time to write, right? Second thing is, you may not have the confidence in your own skills of writing, right? So you may want to hire a medical writer or a scientific writer for that matter. And many writers in the medical writing field are homeopaths. Hundreds of them are BHMS graduates, right? So for your homeopathy papers, you can hire a homeopath writer to help you with, right? So how do they help? Studies have shown that they reduce the time from submission to review and publication, because they have fewer errors when they write, or they follow the specific ethical guidelines because they are aware of the guidelines. Their community workshops are based on those publication guidelines and all, right? And they know how to strategize the visibility of your paper. Now about authorship order. How many first? Yes,
I have a question. These medical writers, I'm just asking you, do they delve into the subject? For example, if you
they are not subject matter experts.
That's what I want to know. Suppose you're writing a basic research paper, so you need to have an understanding of all the analytical parameters of the subject. You have to delve into that before you write.
Yes, absolutely.
Understand? So, do you really think that they'll be? I think, except for the language part.
So they are writers for you. So if you think of let's say Mahabharata, who was the writer of Mahabharata? Yes. Anybody? Can we have the mics go around? I think. Who?
He was the orator.
So the author was Vedvyas. It was his idea, his story. The writer, sir said, was Ganesha. Ganesha was the writer. Ganesha wrote it down. So Ganesha does not claim authorship. Here also, medical writers do not claim authorship. So you need to guide them what to write. As a
आप उनको they'll not be able to comprehend the subject expertise into the language which is understandable, or which can make an impact on the readers. That's what my query is. Even if you make them understand the subject, जब तक आपको उसकी पकड़ नहीं होगी, वो कितना भी.
So you need somebody from your background?
No, I'm just asking that, like, these professional medical writers, maybe
they're all life science background people who have basic life science understanding at least. The least that they have is a life science understanding. Time they have.
At the same time, sometimes it's other way around also. They have the best of knowledge, but they're not able to express that in the paper.
Yes, that's
So
why
that's also a
they
very
write
big
it down.
limitation.
You know, usually what we do is we were working on a bariatric surgery book, textbook, right? We had queries about the surgery procedure and all. We wouldn't know the procedures, right? Even if we might have studied in our college, right now we don't know what is the current procedure and all. So we would put a comment to the authors. Could you please confirm our understanding is correct? This is what we've understood. Is it correct? So writers never work without the supervision of the authors, and they should not. Authors have to supervise that. They have to take the accountability. Ultimately, the accountability is of the authors, not of the writers, right? But yes, they make things easier for you, reduce the time, reduce the number of grammatical or spelling errors that could be there, and they know a way of writing the papers, right? Because of their experience in that field, in writing. But yes, you are right, subject matter expert, they do not have the subject matter expertise. You have to guide them. Now, about the number of authors, how many authors can you have in a typical manuscript? There's no number? There's no limit? For a research paper, there's no limit. Is there a limit for other kinds of papers? For case reports, I want to have 50 of my colleagues in a case report. Would you allow that? How many would you allow? 4, 5, that's the limit that you have set for your journal, right? There are journals which have a limit of 3 authors. You cannot have more than 3 authors looking at one case, right? So they believe that if you are adding more number of authors, it's just to add guest authors into that case report. So yeah, number of authors, you need to check the instruction to the authors in the journal. Order is the problem, okay. Order is a problem. Now, how do you decide the order of authors? He's actually not wrong. He's actually not wrong. So, the ICMJE says editors should have no say in the authorship order. Authorship order is a decision between the authors group. They should decide who should be the first author, who should be the last author. Now, if you look at a paper and see that the last author is, say, Dr. Das, don't assume that the Dr. Das is a senior author. That's not true. Right? There are some journals which say that the senior author should be the last author, or the senior author should be the first author. There are some journals which say the author who contributed to the most should be the first author, the author who contributed a little less than him should be the second author, and in that order it should be there. So there is no hard and fast rule. You look at the journal's instruction, what do they say? But ICMJE per se says the authorship order should be decided by the authors, not the editors. Editors should not guide the authors in how the authorship order should be presented. Like when MCI was there, MCI had, even now for that matter, NMC says the first 3 authors only should be recognized for promotion. Their contribution is recognized for promotion, but the other, author number 4, 5, 6 do not count. Have they not contributed substantially? They have contributed substantially, only that's why they are in the authorship list. Otherwise, they wouldn't have been in the authorship list, right? But it is the NMC's order that, first 3 authors will be considered for promotion. The others will not be. In that case, the authors can sit down and decide, okay, last time I was among the first 3, this time you can be among the first 3. We are publishing 5 manuscripts in this year. We should rotate the orders so that everybody gets the benefit. But for the editor, it makes no difference. For the assessors, it does, right? So we actually wrote a paper some time back. When NMC was there, I had written this paper on why authors' contribution details are more important for assessment rather than authorship sequence, right? This is also a case and example in journal selection. This was published in the National Medical Journal of India, and it was, for me, because as an author I would say it was a critical paper, right? Because MCI had at that point said only the first and second author should be considered. I started questioning that, if you say that an author is one who has contributed substantially to the paper, then why should the fourth or the fifth author not be considered for promotion? All authors should be considered for promotion. Or you have a criteria that this much of contribution is considered as substantial, and for that you need to know the contribution details. Do we not submit the contribution details when we submit to the journal? We do. We do mention what each author has contributed to. There's a contribution form also.
So there's another point. In fact, the authors at the fourth or fifth order are basically the ones who need the contribution details to matter more.
Yes.
Because they are at the stage of their career where, all these things would matter to them. Probably the ones in the first two are already there. Yes. And they're getting there. So if they do not get credibility the rewards for that, then I think they're just not getting there.
So this, why I said this is, that's a point, that's a good point actually. Why I said this is a point to remember for, this is an example I cite for, journal selection. We thought National Medical Journal of India is a very good journal, and it is India specific thing that I am talking about. I'm talking about the MCI regulations, so I want to publish it here. This was the journal I chose. But do you know how long it took us to have this journal article published? We submitted this in 2018 or 19, I think 18 end, right? They liked the article, but the review took long. When they sent us comments, we replied immediately. Within a couple of weeks, we returned the comments, revision. But they took very long to actually accept it. When they accepted it, they could not publish it because of COVID. They did not have the, office functioning. They had more important things to do at that point. So this got actually published in 2021.
But of late I think this approach has changed, because there's this institute called InflibNet that is also doing a scoring for Indian scientists, where they are giving 1 point to all the authors regardless of their sequence.
Yes.
And that this is what is that software? Is it Vigyan in? Vidwan. That is where they are giving a kind of scoring to all Indian scientists regardless of your fields.
Yes.
So for now, their approach is that regardless of your first or the last order, you get 1 point for each paper.
You get a point, but in NMC guideline, even today, says the first 3 authors are counted for promotion.
Even today?
Even today.
No, they have not changed after this also.
They have changed. NMC changed. Like when we wrote this paper, it was MCI, and MCI also got converted into NMC when this paper was ultimately published. I said by the time it got published, MCI was not there, and it didn't really matter. This paper didn't matter. But their approach didn't change. They still say, initially they were saying 2 authors, now they say 3 authors. That's the only difference. So this did not bring a policy change. I wouldn't claim the policy change was because of this. But, I think this mattered at that point. If they had published it at that moment, it would have mattered. It got delayed. So dealing with authorship and acknowledgement, how do you do that? When should you talk about authorships and acknowledgements? Before you write the paper, please. Sometimes before you even start the research, you decide who will do what and what will be the authorship order, right? And it's always an authors group's decision, the group's decision. It is not anybody else's decision. Whether you want to have your HOD in the list or not is your decision. You have to decide whether he has contributed substantially to be named as an author or not, right? Because you will be writing in the authorship declaration forms that they have contributed substantially, and they have contributed to this, and this point. So you have to specify.
There are some articles I have actually seen. There are some articles which are related to some colleges, academic institutions. What they did actually, they have given authorship to the HOD and acknowledgement to the HOD. The same, both.
Yeah, it doesn't help actually. It should be either an acknowledgement or an authorship. But yes, in the contributorship, you can mention how he contributed. Yes, that you can do. So, I would suggest identify the individual needs. Who needs to be the first author? How will he benefit? Right? And then communicate within that group. Agree on something. Have a backup plan. What if this person doesn't do this much amount of work that he was supposed to do? Do we bring him back to authorship number 5 or keep him at authorship number 3? Right? That is a decision. You should have a backup plan. And then document everything. These discussions should be documented so that if there is any controversy later, you know how to deal with it. Conflicts of interest. What is conflicts of interest? And what are these 3 types of conflicts of interest? Anybody who wants to talk about conflicts of interest? What is conflicts of interest?
No, actually. You can
I will not take an answer from Harleen ma'am now.
that's what I'm saying.
She's an editor. She knows what is conflicts of interest. She is checking your conflicts of interest when you send papers. So she is not the one to answer this.
A type of conflict might be, suppose a pharma company is sponsoring
A study.
a drug, and also means he's the manufacturer also, and he's also from any other route he might be financing the study also. So it is one of the conflict of interest.
So conflicts of interest, here I'm talking about the conflicts of interest of the authors. So if somebody from the pharma company is an author, there is a definite conflict of interest, right? They are definitely trying to promote their drug, right? Yes.
We have taken some, like for the investigation, we have taken services from the microbiologist or something like this, like QH Mount we are doing, and he is asking for the authorship. Then it may be the conflict. Maybe he don't have a substantial role in the authorship, but he may be claiming to get the authorship.
So if he doesn't have a substantial role, then he disqualifies as an author. So you should not include him as an author. Even for the pharma authorship also, if the pharma company representative doesn't mean MR, representative means an official from the pharma company. If they want to be an author, they should have contributed significantly to the research. Not only in conducting the research, but in all 4 aspects of the research they need to contribute. Right?
And also one can be if a person part of a committee who is monitoring the study, and a person from that committee is also named as a author also.
Yes.
So that can be
There can be a biased reporting, right? There can be a bias in the report. That means there can be a conflict because they have an interest in that particular study, right? That is there. So if you may be a consultant to a group which is promoting that kind of study. So that is a conflict of interest. Not always a financial conflict of interest where you're getting paid by the company, but other kinds of conflicts of interest. Also, if you have a very close relative, first order relative, working in that company, then also there can be a conflict of interest. I may not be an employee of Pfizer. My husband might be working for Pfizer, and I might, write an article which promotes a drug by Pfizer, right? Then that is also a conflict of interest, right? So another is if I have equities and shares in the company, I would like their product to be marketed more so that I get benefits, right? So conflict of interest basically means if you have an interest there in that particular study, right, then you have a conflict of interest. There can be a conflicting ideas there. You might try to subdue the negative results and promote the positive results. So there is a chance of conflict of interest. That is why now ICMJ suggests journals to not have a section called conflicts of interest, because all of us write none. Conflicts of interest, none. No conflicts of interest, right? Is it really true that none of the authors have any conflicts of interest? Very rarely it is true. So now they call this disclosures. You make a disclosure, let the reader decide whether you have a conflict of interest or not, right? From your side, you need to make a disclosure only. You are not saying it's a conflict of interest, you are just disclosing what could be a conflict of interest. This is what is a new change in the ICMJ guide. Yeah. So you don't have a section on conflict of interest. It's called disclosures. Yeah. Yeah. It's a good thing to adapt to actually, because then people will not think that, it is a negative thing and they will come out with disclosures. But otherwise authors usually write no conflict of interest. How many authors will write that we have a conflict of interest with the study? They don't.
There are papers where it is declared.
Very few who are actually sticking to the ethics and know that there could be. Yes, some are declaring.
Pharmacy, this pharmacy is sponsored.
Yes. They should. Ideally, they should. So now it is called disclosures only. What is copyright? What is copyright? Anyone wants to take that question?
Copyright, ma'am, there are several categories defined, 5 to 6 categories. My manuscript is whether it can be shared or not. Means if I have a copyright on any article and any other person is using it, he has to acknowledge my paper. He has to cite that paper. Mm-hmm. So under that legal agreement, it falls whether it can be modified or not. It can be used commercially or not, or it can be only advanced upon. The work can be advanced upon.
Yeah. Okay. So yeah, good response actually. You covered a lot of it. Now suppose I have a copyright on a paper. I have written a paper. I own the copyright. Tomorrow you want to take a table from that paper. You put the table in your manuscript and cite my manuscript. Is it ethical? Is it unethical? Sorry? Citation is there.
It depends upon the type of copyright. Okay.
Depends on the type of license.
Type of license one
has. But copyright holder basically means a person who has the right to copy. So if I have the copyright, only I have the right to copy it and publish it anywhere else. But ideally, most authors have already transferred their copyright to the publisher or to the journal. So they do not hold copyright of the manuscript. You cannot, copy the same table from your own paper and write it and publish it anywhere else in any other paper. So the copyright has already been transferred through the publisher. Yes, even though you're acknowledging it, you cannot cite it. You cannot use that again. So you do not have the right to copy it. Right? We don't realize this, but when we sign the copyright agreement form, we are already transferring it to the publisher, not even to the journal, to the publisher. So, the journal may not have the copyright. For that matter, Springer Nature may have the copyright, or Elsevier may have the copyright. They can reuse it, you cannot reuse it. And they can file a legal suit against you if you reuse it. So what you should do, if you want to add a table, you find a very nice table in a particular research paper, or a figure in a research paper, or a nice flow chart, and you think it really is a wonderful one, and you don't want to change anything in it, and you want to reproduce it in your paper. What you do is you add a citation, and in the footnote write reproduced with permission from this citation, right? The author's name and the journal name and the year, right? You write that reproduced with permission from, and for that you need to seek permission also. You have to write a letter to the publisher or the copyright holder, whoever it is. Some journals do not ask you to change, transfer the copyright. Authors do hold the copyright. So there are some journals, you have to look into the instruction to authors for that. Plagiarism. So it can be pronounced as plagiarism or plagiarism. Both are correct. I pronounce it as plagiarism. It's more comfortable for me. So plagiarism means literary theft. Right? Plagiarism actually means kidnapping. Right? So there are many different kinds of plagiarism. Can plagiarism be unintentional? Yes, it can be unintentional. Right? And it can be intentional also. It is unintentional when you do not do a proper paraphrasing of the text. You copy the text and put it as your own text, right? Then that is paraphrasing, not because you are unethical, but maybe because you do not know how to paraphrase it. You do not know how to write it in your own words, right? And poor quotation, like you have taken a quotation but not put it in quotation marks, right? Verbatim you've taken something. And poor citation is you have not cited it properly, right? The way it should be cited, the citation number, and all the details about the paper so that it is searchable for anybody who wants to know more details about. So unintentional plagiarism is there, but when you do it intentionally, it is intentional plagiarism. And is unintentional plagiarism unethical? Yes, that is also unethical. You cannot say that I stole this money from your cupboard by mistake because I thought it was mine. You stole it, it is unethical, right? So even if you do it unintentionally, what editors usually do is, if they detect any plagiarism, which to them looks like an unintentional thing, they ask the writer to revise the paper and remove the plagiarism. But there are times when, plagiarism is caught and authors say, they claim that it was unintentional. They didn't mean to, but they did it. Don't try to outsmart the peer reviewers and editors. They know their job. They know how to detect which is intentional and which is unintentional, right? For students, this happens many times with students' thesis. They say, oh, it was unintentional. We didn't do it intentionally. But teachers are clever enough to find out which is intentional. Yeah. Now, types of plagiarism. Text plagiarism, a block of text taken as it is and added in your manuscript without proper citation is plagiarism. With citation is also plagiarism. Even if you do it with citation, but you copy a text from one manuscript and place it in your manuscript, it is plagiarism. In text plagiarism, there are two other types which can be talked about. One is mosaic plagiarism, another is self-plagiarism. Mosaic plagiarism, what is mosaic? You have bits and pieces joined together to form a design or something, right? So mosaic text plagiarism is when you have bits and pieces of text joined together, not one full paragraph copied or not one full manuscript copied and pasted as your manuscript, but few sentences, few phrases, very uncommon phrases, if you copy it from another manuscript, even if it's not a full sentence, that is still considered plagiarism. Because text similarity will be shown by plagiarism detecting software, right? Now, what is self-plagiarism? Self-plagiarism is when you copy your own text, publish somewhere else, and now present it as a new text by yourself, right? Even if you copy something from your own publication, you need to reword it and cite it, right? Even your own article, you cannot copy and paste as it is. Images, I discussed about images. We cannot copy images from other sources and pass it on as our image. And simple citation is also not enough. You need to have permission for that. Ideas, even if it is not a text, full text copied, not full image copied, even if you are copying an idea from another manuscript, you need to cite it as their idea, not your idea. Basically, when you pass something as your own without acknowledging the original creator, then you are plagiarizing. And there are plagiarism detection software not only for text, there are plagiarism detecting software for images also. So how do you avoid plagiarism? First thing is just remember that you should not try to reword, rephrase. We say write it in your own words, but when you take one paragraph and try to rephrase, you are actually jumbling up everything. Take the main idea, close that window, write in your own words. Then you will write correctly, right? You won't copy anything from there. and always acknowledge the source, cite the source. This is a well-cited article that I had written a long time back. This gives a few tips on how you can avoid plagiarism in your article. You can take a look at it. It also has some examples of what happened to people who were caught plagiarizing some text, right? And all the examples are from Indian doctors. So this was an idea from the editor, how editors help us improve our articles, right? So initially when we wrote this article and submitted it to the journal, they said it's a wonderful article, we like the article. But can you say what happens if somebody plagiarizes? What will happen if they plagiarize? They will just be called unethical, right? Or is there any punishment for that? Like I mentioned, it is not a law, it is ethics. So there is no hard and fast punishment, but what happened, what punishment was given to them? There were some examples that we cited after that. After this, came back to us after peer review. No, not really. Not really. So sometimes it, this is at a time, this is 14 years back, they didn't have a plagiarism software that time, and they wanted us to cite examples from maybe another 10 years previously, right? So there are examples from AIMS Delhi also in that, where the author realized that there was plagiarism and retracted the article. So that is also there. Now, what is duplicate publication is when you have two same articles in two different journals, right? That is duplicate publication. Duplicate publication, ideally you should avoid duplicate publication, but there are times when you can have duplicate publication. So one is when you have a different audience altogether. You have published something in an Indian, for an Indian audience, a journal that is circulated locally but does not reach to the global audience, but you decide to send it to a global audience journal. You can still do that. Or it is translated for a different language group. Like if there is a Chinese publication and now they want to publish it in an English publication, that is allowed, right? Yes, yes. For any duplicate publication, you have to write it in the cover letter that this is a duplicate publication. Yeah.
So we have to get the permission from the first journal.
Yes, first journal publishers must, give an yes, publisher, the copyright holder for that matter, whoever has the copyright needs to allow you to publish it duplicate. Then primary publication should be clearly acknowledged and cited in the second publication. Then, yeah, obviously it is not presented as a primary result, but something that has already been published, right? This is a very good example of duplicate publications. You all must have seen this in many journals. This is just 3 examples I've given. It was published simultaneously in maybe 20 journals or so, right? When the Indian Association of Medical Journal Editors decided that MCI was doing a wrong thing by asking, for only 2 authors to be promoted, asking only original research papers to be considered as research papers, and for the indexing, they said Index Copernicus was similar to PubMed. It was not. Right? So the indexing database that they had given initially. So this was then promoted by the Indian Association of Medical Journal Editors. Initially, they published it in 2016 for a couple of journals where the editors were chief editors, Dr. Rakesh Agarwal and Dr. Piyush Sahni. They published it in a few of the journals. Then as an association, as a group, you can see the third one. This published it as a group, all the journal editors. But they also added this disclosure to the journals, right? This editorial was not endorsed by all members of IMJE, because some members of IMJE were also part of MCI, right? They were the guidelines maker. So they could not be endorsing this paper, but simultaneously it was published in so many journals. Right? Sorry?
Ayurveda journal is also there.
Oh, okay. Yeah.
National guidelines also.
Yes.
Guidelines also publishing different journals.
Yes, together they are published in different journals, yes. Overpublishing. Have you heard of the term salami publishing? What is salami publication? First is, what is salami? There is a picture. Slicing into smaller slices, yes.
In the manuscript planning, then you are doing the part publication of your main research.
Yes. So you have one study where you studied about the lipid profile of group of patients following administration of drug A and drug B. Right? Two groups were there. You compared. Now you publish one manuscript as lipid profile of drug A, another manuscript as lipid profile of drug B, the third manuscript as triglyceride elevation with drugs A and B, fourth one, HDL, sorry, that would have been reduction, HDL elevation with drug A, HDL elevation with drug B. Then you're slicing it into small bits and publishing one research paper, one research, not as one paper, but as 5 different papers. Is it unethical? Yes, it is unethical as long as it is not unethical for certain cases, but it is unethical in most cases it is unethical.
The objectives, like if primary objective is given as the research and the secondary objective is can you just take a mic?
Yeah, just.
Ma'am, it's like if we are having the primary objective, which is the main aim of the research, and we are publishing it as a main paper, and we are having some secondary objectives, and if we are putting the whole thing in one paper, it will be like a very big, maybe
paper.
It won't satisfy the journal guidelines also regarding the page and word numbers also, and the secondary objective may be entirely different from in some aspects, in the methodological aspects, so it can be given as a separate paper, no?
You can give it as a separate paper, yes, provided you're transparent enough, saying that it is both the studies are the same study, same sample size, same study. These are two different reports of the same study.
So it has to be mentioned in the manuscript
Yes,
itself.
and the primary results, wherever you have published it, should be cited here also. Or you must mention that the primary results are being published separately, and these are the secondary results.
Also, I think,
Yeah.
I think it's not only for the authors and editors to decide about this. I guess this is also there's also an ethical component to it.
Yes.
So you need to inform your ethics committee and take their permission and their opinion also on this, whether this really would make a different paper.
Yes.
Because when you set out with the protocol, with the objectives, you meant to write one paper about it. So when over the process you start feeling that there could be a split on the results, then I think this needs to go back to the ethics also for the similar discussion.
In homeopathic perspective, when we are speaking, no, as for example, if you take a clinical research in which you are studying some individualized homeopathic medicines in a particular disease condition, for example, diabetes mellitus, then we are going for a publication like symptom profile of the patients as per homeopathic perspective in diabetes mellitus. That can be a different paper, right? And the effectiveness can be another.
But then that paper, homeopathic perspective, would not only talk about your particular study, it might talk about other papers also.
Yeah, it would actually become a
review
can
paper.
come. Yeah, it can come. But in our cuff research also we have done that.
So
same thing we have done.
Yeah, so there was one broader outlook where we were talking about prognostic factor research of an approach to prognostic factor research, and then we were talking about cough results per se.
That's an example, ma'am, that what we have already done, but
Yeah.
I don't know whether this ethical aspects were considered in that.
Because it was so this was one study which was like
Because
conceived in 2016,
majority
17, and
of our clinical trials can be like published as
Yeah.
in many aspects. When we are viewing it in many aspects, we can get so many
Right. So
components out of it.
So even since 2016, 17, the ethics approach has also changed considerably.
Yeah, thanks. You gave a good point actually. That happens. Suppose it's a huge study. Let's take recovery trial or a relay trial. There are so many huge trials being conducted and multiple papers come out of it. Is it ethical to have multiple papers or unethical to have multiple papers? It is unethical to cut it down to too many small pieces, but larger chunks can be published as different papers, definitely, as long as you are very transparent that it is the same sample. Same study, it's part of the same study. So you can have, let's say we are having a, like this example I mentioned, lipid profile after drug and drug B. You can have two different papers, one titled as lipid profile after drug A and the other one is lipid profile after drug B. That's ethical. But you must also mention somewhere in the paper as well as in the cover letter that these are from the same samples.
It is now the drug A and drug B.
But the sample is the same. Study is the same. Study is the same.
But interpretation is the same thing. The
Objective is the same, yes.
that objective is being divided into two papers.
Yes, you can divide it. That's what I said. Only thing is transparency. As long as you are not putting it as two different studies, you're putting it as two different papers from the same study. As long as you're doing that, it's fine. Many clinical trials are published as 10 papers, 20 papers, but they all come back to say that, it is the same trial. You need to mention that the study is the same. Why you need to do this is when somebody else later on goes on to do a meta-analysis. It will be a faulty meta-analysis if there are multiple papers on the same study, but not exam. Same outcome also. Or no, even if it is a different outcomes also, but if you're not mentioning that it is the same sample, same study, then also it is going to be an error when you do a meta-analysis.
What really happens is, in all these cases is, this is a situation which is true for a lot of public health research also.
Yeah.
Because in public health research, the samples are like quite big. There are a lot of objectives which are put into the picture. So one paper never is able to do justice, and rather you cannot that is not even the right practice of presenting and putting everything together. So this is what is done in that case as well. So what really happens in the methodology, of course, for all these identifies and explicitly states about the sample that was put in, the time period, everything. It remains same for all the papers.
Yes, the methods mentions everything
it
clearly
mentions
that it's the same paper.
We are also going to mention the CCRH number, the registry number, that remains the same in all the paper. And it specifically mentions that this particular objective is being, talked and explained, and the results and so on and so forth.
And if there is a publication already by the time you write the second paper, if there is a publication, you should cite that also.
But then I do understand the magnitude of the public health data that we have, but then is this preconceived? Is this something that we have kind of mentioned in the protocol at the start, that this is what we set out to do? Probably because because in our case also, in the cough case, Dr. Vinita, I had a lot of discussion with Dr. Lex about this, and eventually over a lot of correspondence, I got a clarity that, the overall idea of doing a lot of prognostic factor research in bits and pieces was to come out with an outlook, a broader outlook towards the prognostic factor research, which, if not published, will not do justice to the broader work that we wish to do. So there was a paper that talked about what happened to the cough in homeopathy, and then there was a paper that talked about prognostic factor research per se. But then we had not really admitted in the beginning that we set out to do this, which was my point of which was my point of resistance with him. So, like what you are saying is very true, that, if you have a whole lot of data and you are not, you can kind of foresee that you will not be able to do justice to this. Can this be declared in the protocol somewhere? Can this be put out on paper earlier? So I think that would take care of a lot of things that would fall into salami eventually, that, the authors are being opportunists. Not that they have too many outcomes, and so they are trying to be playing a little opportunist here, that let me just have 5 papers out of it. So that might not be the intention, that could be the impression on the other side.
If that paper is not published and if it is still in the review process, the one paper is still in the review process, we don't just say that, no, this is a part of, otherwise we have to mention it like
we
it's
should.
a part of.
That is the foremost thing, like ma'am is saying, at least be integral to it. That integrity on the paper should show, both the papers should mention each other, I guess. No, the previous one cannot, but then the subsequent one should.
Yes. So you basically need to be transparent. I cannot, emphasize on this enough, that you should always be transparent in science. Right? As scientists, we need to be transparent about what we are doing. We find negative findings, we need to be transparent about that. We create multiple papers out of a single study, we need to be transparent about that. There's nothing wrong in doing that. Right? Nothing wrong in publishing 10 papers out of one clinical trial, but you need to be transparent that all these 10 studies or all these 10 papers are actually from one study. The sample is the same. Even if it is a sub-analysis, some group analysis you're doing, subgroup analysis, you need to mention that this subgroup is from that same study. Because when later on somebody does the meta-analysis, and policies are all based on meta-analysis, not on single research papers, right? So when policies are based on meta-analysis results can be altered because of, these salami publications. What is Himalayas? Anybody knows what is Himalayas? Yes? But I did see you do some gestures with it. Yes, it is salami read backwards, right? Himalayas is nothing but salami read backwards, but it is a term commonly used in publication. Himalayas publications mean when it should have been 2 studies, you have combined it and put it as one paper and one study, right? Even that is unethical. Like, for example, one of your students has done a study on, say, 120 patients and published it. Now another student comes in, does a similar study at a different timeline on another 80 patients, right? But you're not being transparent about it, and you're saying you did a study of 200 patients, a much larger study, right? That is Himalayas, right? Is it unethical? Yes, as long as you're not being transparent. If you're transparent, if you're mentioning that this was done by, this study was done earlier on 120 patients, now we added 80 more patients to it, and we are publishing it. That is fine.
Then can I, in retrospect, if you're taking a particular
If you're taking a particular clinical
topic,
topic as a retrospective study for a past 5 years, we are studying a particular disease condition which is commonly presenting in our institute, and for the past 5 years, what is the prevalence, or what is the incidence of that condition in our hospital, and how the patients are responding to it, and we are going for a retrospective study after all the ethical approvals. The problem is that being a clinical research institute, we have already publications on those particular maybe that is 30, it is maybe a PG thesis, maybe 5 it is a case series, maybe 1 it is a case report. But when we are going for a retrospective study, we are considering all these studies. Whether it is ethical to do that, or
it is absolutely ethical. You need to mention how you decided on the sample that you are studying, right?
Okay.
Yeah, your methodology should tell what is the sample. This is the time period we took, and this is the eligibility criteria based on which we included those retrospective patients into the study.
Those cases need to be cited then in the
No, not all the case reports. No, because your sample is different, right? You don't need to cite each case there. Your study is totally different. Your methodology is talking about a retrospective study and not a case report. Suppose you were citing different cases, then you would cite that, okay, these cases have already been published. You might add a citation, and then you might say that, okay, we had 3 cases of this earlier, now we have 10 more cases, so we are publishing it now as 13 cases. Right? That is all that is fair. Like I said,
Form, you don't need to cite those cases.
No, because you are mentioning your criteria for selecting those patients, right? You're clearly mentioning that.
And copyright holders won't have any objection on that?
Are you going to use the exact words or exact pictures or anything?
Similar data.
Similar data is fine. Similar data is fine. Not the exact pictures. If you have already published those pictures, you should not reuse those pictures. But you can, give a reference to those pictures in the manuscript. In your manuscript, you can give a reference that this has been published earlier. And give a citation there.
What about when we are coming to a systematic review of that?
No, systematic review is a review of research that has already been published. So it is ethical. It is a study of research, right?
So in retrospective, we are considering all those cases?
Yes, you are.
We are considering all those cases in retrospective, so that 30 cases is already there in that.
Like I mentioned, it's only about transparency. As long as you are saying that this is how we have done it, you are being transparent.
So
and you are being
in that systematic review, we will be excluding that.
Including, you can include those patients, but you are transparent that you have included.
Anyway, they should be counted as 2 different entities. Anyway, because if the one that
So the one that we have already published and the one that we made a study out of, they are anyways 2 different entities. The 3 cases that you might have published, and also maybe 10 case series that you have already published, and then a study that you eventually made out, including those 13 cases, anyway would bring altogether a different entity. So there are 3 different entities, so they should be counted thrice in systematic reviews also. If you are including case reports in your systematic reviews, then they should be counted as 3 different entities.
I can't understand how it is going to be statistically relevant, because that 30 cases has included, that 30 is the number. If you are counting 30 plus 3 plus 2,
Yeah.
it will be the same.
No, but you must mention that those 30 have been counted earlier.
So one is a study. No. But then the 30 is a study. It's a retrospective study. And the 3 cases that you included in that 30 was a case series. So it was a different entity. This might be a problem where you say you have a retrospective study of 30 cases, then a similar retrospective study of 60 cases where you've also included the 30 cases. Then its entity is the same. One retrospective study included in another retrospective study. I don't know if that is done, but then...
So nothing wrong with that. I said, as long as you are being transparent, you just need to mention that this has already been published. This is the citation, and we are including those cases now in the current study. The disclosure is more important than anything else.
But it's not only about ethics. What she is saying is, she's not concerned about ethics
The study
here.
design.
She is concerned about the outcome in the systematic reviews. Will that be flawed?
No, that will not be flawed because it will be included, right? When somebody sits down and does this systematic review, when they look at these papers, the larger paper, they will, of course, know that these 30 are from the previous paper. So they will exclude one of those papers, right? Exclude the one with 30 papers, obviously.
Exclude?
Yes, because this is there.
It has to be excluded, otherwise they will not take it duplicatively. If they try
But then the point remains that the 30 that you actually included.
Exclude as in you don't include the 30 published earlier as a separate paper, but the 33 that you are publishing now as a single entity.
Oh, okay. Okay.
Yeah.
But
Yes.
But then,
she's right.
But then it again depends on the proportion. The point that you started from was that perhaps you published 3, and now you are publishing a retrospective of 30. In that case, why would you not include those 3?
If we are planning for a retrospective, see we are all like mics, I guess. I don't need a mic, I think I have all of it.
We are streaming online.
Thing is, Dr. Harleen, we are nearly more than almost 10 years of experience. No, we can do a past 5 years study on a particular research topic in which we are expert. And while doing that, no, we have already published many case, even clinical studies we have published in that. And while going for a retrospective study, say we are getting 200 sample, which all the documents which are present, and from the 200 sample, 30 plus is published as a case series, 30 is clinical trial, 30 is another clinical trial, and there are some case series and case reports, some unpublished cases also. Right, coming in that, no? And if you are going for a systematic review and meta-analysis, considering these are separate studies, and we are doing a retrospective study, it is also published. You consider that it is also published. And we are taking a systematic review in which we are considering this retrospective study, this 30 clinical trial, another 30 clinical trial. Then when we are coming to the stat, no, it will count as 200 plus 30 plus 30. Actually, it should count as 200. We should exclude 30, that 60 cases we should exclude. But I wanted to know whether it is ethical to do a retrospective study on case series, which are, clinical studies which are already published. Can we include it in a retrospective?
Yes,
that was my query.
You can.
Whether it is ethical or, yes, it is.
Yes, you can. Only thing is you have to be transparent that these 20 studies have already been published. You need to mention that in your current publication as well as in the cover letter to the editor. Because editor is not going to sit down and read the entire manuscript. Editors hardly ever read the entire manuscript. They have hundreds of manuscripts on their desk. So they will probably just read the cover letter to get an understanding whether this needs to at least go into the peer review system or not. Right? Other ethical issues? Fraud. What is data fraud? There is no patient or no data, you make fraudulent data, you make up the data. That is fraudulent data. Data fabrication is this. What I said was actually data fabrication. Fraudulent data is there are patients, there is data, but you manipulating the data. Right? You have 20 patients who actually benefited from a drug that you gave. But there are 2 patients who did not benefit. But you want to tweak the data a little bit and say that they also benefited. Then that is fraud.
Mostly dissertations.
Yes, mostly in student dissertations. Publications also. Then selective reporting. When you report the positive findings but do not report the negative findings. There is efficacy, but what about the safety part? Was there any adverse event? You need to mention that also. Manipulation of references. How is manipulation of references done? Any idea how an author may manipulate the reference? Self-citation. Yes, self-citation is one. And we all do that.
Citation cartels.
Yes, citation cartels. When you cite my article, I'll cite your article. Right? That is also there.
Also, referring to the secondary
research, not the primary research.
Not the primary
There is another thing, avoiding citation.
Avoiding citations.
In order not to get the publicity of that particular.
Yes, yes. When you don't give due recognition to the previous research on that same topic, then you are also manipulating references. So manipulating reference, one is citation stuffing, where you add a lot of citations
for a single point.
For a single point. That is seen very often.
There's so much traffic there.
Right? The sun rises in the east. How many articles can you write on the, cite on that? But why do you want to cite?
Just to show that you have referred to like 100 number of cases to make this.
You've read so much.
There is so much. It's so much of traffic.
Yes. So if there are multiple relevant articles that you find which talk about a particular idea, about a particular topic, what should you cite? Should you cite a meta-analysis which talks about that point? Should you cite an original research paper? Or should you cite a case report for that matter? Which will?
Meta-analysis. We follow the pyramid.
You follow the pyramid. You cite a meta-analysis. If you have a meta-analysis on a particular topic, cite the meta-analysis. If there is no meta-analysis, look for case reports. Nothing wrong in citing case reports. Anecdotal reports are good. In fact, I would encourage everybody to cite case reports, because we do not cite case reports. Journals do not publish case reports. Later on, ma'am is going to talk about journal metrics. I'm sure you will talk about how journal metrics is affected by the number of publications, right? Editors do not want to publish case reports because they are not cited. Because denominator becomes large, numerator becomes low, right? Now, abstract or preliminary, results of a paper, if you want to cite, or a preprint of a paper that you want, a research study that you want to cite, then you need to mention that you've only seen the abstract. You have not read the full paper. So in the reference section, you need to mention within square brackets abstract, that you've taken this from the abstract, or you've taken this from the preprint version, because preprint versions are not peer reviewed yet.
So we should not actually mention.
No, you can cite a preprint if there is no study on that particular idea, but it is a fresh idea that you have, but somebody else also had that idea and has published a preprint. It's not been peer reviewed yet. You can cite.
Also, but that preprint is undergoing a lot of review process. We are still not sure that what comes out.
So you are citing and with an access date now.
Yeah, it's just about a view that you are giving. You can even cite a tweet. You can cite an X post, a Facebook post. Then why not a preprint? It's just that you are saying that this view resonates with this particular paper or view. Yeah. So you can cite anything.
You can cite an article published in Times of India.
Ma'am, regarding abstract, means if the paper is behind a paywall and we are not able to get access to it, and we are citing based on the abstract only, so we have to mention
that it is abstract.
We have taken it only from the abstract.
Yes, because you have not read the full text. The full text may say something different, slightly different. May give a bigger picture which is not visible in the abstract. Though ideally it should be visible in the abstract, but if it does not give a full picture of the thing. Am I going too slow?
I don't know. I'm with you on the pace.
Okay. So citing without thorough reading. Never do that.
So what happened to the coffee break, by the way? Sorry, I just got so lost.
Oh God.
How are we doing with the break?
They're ready.
1 moment. We can ask them. I mean, it was meant to be at 10:30, but then we just got lost with the time.
Can we stop the tea and table?
How does the delegation feel about it?
Coffee on the table? Okay. We'll continue that.
It's mixed kind of views. I don't know. We are being served on the table.
Anybody wants to go and use the washroom, go, come back. We can continue on with
let's have a classroom model approach. You can go to the washroom, come back, and we can be served tea here.
So we can continue. We are going slow, I know.
A word from the senior officer that do come back.
Yeah, do come back if you think it is, helping you. If you think it's not helping you, I am okay with an empty, hall with talking. I am okay talking to 2 people also. But if you think it is helping you, do come back. Okay, there are new ethical challenges that people are facing nowadays. One is whether to cite a preprint or not. We discussed this right now, that you can cite a preprint as long as you mention that it is a preprint version that you are referring to. Artificial intelligence, whether to use or whether not to use, we'll talk a little more about that. Then there is a discussion about inclusivity and diversity and equity. It doesn't really matter in Indian context. In the US context, it matters a lot, right? Because they do not want to promote, blacks as first author. They want all the whites to be as first author. Racial discrimination is a lot there. In India, we do not have that so much as racial discrimination. Do we have it as caste discrimination? We still do. We have.
At most is junior-senior discrimination.
Junior-senior discrimination. बहुत है. Hierarchy differences है. So we need to avoid, those things. That's the ethical challenges that we are facing now. So what does ICMJE talk about the preprints? We discussed yesterday. Yesterday, Dr. Albina said that she does not promote preprints as citations. She does not promote preprints. That's ICMR's approach. That's IJMR's approach. But if you ask what ICMJ, the larger body there talks about, what is ICMJ? You have all heard about Vancouver referencing? Now, Vancouver referencing was decided on the ICMJE meeting. ICMJE meeting, when the ICMJE was formed, it was formed at Vancouver, Canada. And they decided there needs to be standardization of referencing, there needs to be some standardization of format in which research papers are written. The IMRAD format also came from ICMJE. So this is a larger body. They do not have laws or regulations, they have recommendations. They are recommending that yes, you could put your paper on a preprint, but choose the preprint archive properly, right? So that your paper does not get lost. Choose a preprint archive which gives you a DOI. DOI is a digital object identifier number. So if your paper has a DOI, it can still be cited as a preprint. And also a preprint which clearly mentioned that these papers are not peer reviewed yet, right? And should you reference preprints in submitted manuscript? ICMJ says you can, as long as you mention that this is a preprint version that you have cited. They say that you should disclose and be transparent that this was a preprint. And when you submit to a manuscript, always disclose whether you have submitted a preprint version to any preprint server. Some journals, like the IJMR, do not accept articles which have already been submitted to preprint servers. But Lancet tells you to submit it to the preprint server. So there are different approaches that different journals have, right? So ICMJ says that a preprint publication, will it be considered as a prior publication? No, it is not considered as a prior publication. It is just that for the same research paper, you get two DOIs. One is with the preprint server, another DOI with the published version in the journal, right? And you need to later link the two. Even in the preprint server, you need to mention after it is published, after the final version is published, you need to link and mention that this is the DOI of the published version. And that is the responsibility of the authors.
What would you like to have, tea or coffee?
Coffee without sugar, please.
Coffee without sugar.
Thank you. Yeah. So, citation and linking, yeah, citation, you need to mention it as preprint. Linking, you need to link both the DOIs together. Once it is published, you need to link it. Now, acknowledgement of risk, all preprint servers mention at the top that this is not peer reviewed yet for each article, right? And journal policies, of course, vary. And in media coverage also, ICMJE mentions that if the media is covering a preprint version of an study, they need to mention that this has not been peer reviewed and this is not an established opinion of the expert. Right? They need to be very clear about this thing. So these are some screenshots. The Bone and Joint Journal clearly mentions that it will not consider any papers posted to preprint servers, like IJMA does not consider any papers posted.
I need to mention something here, if I may. Sometimes these journals, the submission process is so engaging and maybe so unpredictable that you sometimes accidentally happen to opt for preprint when you did not intend to, and without knowing the repercussions of it. So I think I know my colleagues who have fallen into this trap. The journal submission process is designed in the way where you would eventually end up pressing a yes to a preprint, and they would encourage. There would be many journals that would encourage you to say yes to it, say yes to it. So we have to be very because I know there are a lot of JMI journals that you would want you to preprint, and they kind of attract you towards it.
Yeah, like I mentioned, the Lancet does very clearly. It says it asks a question, should your journal be put in the preprint server?
Yeah,
and
it
they are
will be-
clear about which preprint server. They say bio RXIV, med RXIV, they clearly
Yeah,
mention that.
so our scientists are so naive about it. They would not realize that, what they are really succumbing to. And without doing that, they have ended up publishing a preprint. And, they have
There's nothing
suffered.
wrong with publishing a preprint.
No, but then, there are, like you're saying, there's some journals who would not even prefer to have a preprint. So then, eventually you might get rejected from that journal, and you want to go to another one where they would say, no, it's a preprint or published or paper, so we would not.
Yes.
So one has to be very cautious of saying yes to preprint. Then also, if you really want a preprint, then which journal?
Yes.
Where? If you are going in for preprint, then let it not be just any journal. So those thoughts have to be before you are actually submitting a paper.
Absolutely. So when you look at JAMA, but JAMA says you need to give a link to the preprint server wherever you have posted your article. Right? It doesn't say no, don't send us articles which have been in preprint. Lancet doesn't say don't post on preprints. Lancet rather says we have a Lancet preprint. Do you want to post it on Lancet preprint?
But then for Lancet preprint.
Yes.
For other preprint, they might not.
No, they do. MedRx also. This is a preprint on PubMed that I found. This is a homeopathy article, I think, right? Is it? I put preprint from homeopathy, but this is what I got, right? So if you see here, on the top it is written that it is published at MedRxiv, which is a preprint server, and in bracket it's clearly mentioned preprint, right? When you cite it using any software also, if you cite it using Zotero or Mendeley, it will clearly mention that this is a preprint version, right? Like it is mentioned here, MedRxiv, within square brackets preprint, it will mention. And if you go to the page where the preprint is submitted, it clearly mentions that this is a preprint and has not yet been peer reviewed by anybody, right? Preprints with Lancet. Lancet encourages preprints. What does COPE say? COPE has a guideline which talks about best practices for preprints and more or less the same as what ICMJE says. These are some publishers. The first three, Elsevier, Wiley and Sage publication, supports preprints. I mean, if you have already submitted to a preprint, they do not say that we will not take your article. Whereas the other four here, Springer Nature, eLife, BMJ, PLOS, they encourage you to put it on preprint because it saves their time in reviewing. While they're waiting for peer reviewers, while they're waiting for the peer reviewers to get back with feedback, they get public feedback, which they can incorporate into the peer review. So they encourage you to, submit it to preprints. And ICMJE also in January 2026, we are talking about AI in medical publication. ICMJE has already published about use of AI by the authors. There is different section about use of AI by peer reviewers. This is by authors, right? You need to disclose at submission, both in the cover letter and in the manuscript. Manuscript, where will you mention about the AI use? You use it in the acknowledgement section, right? There you mention how you use the AI. And you need to mention not just that you've used AI, you need to mention which AI, which version of the AI, when did you use it? Because AI gets updated.
But in how many percentage of manuscripts you really feel they have disclosed this use of AI tools? No, just being an editor, just asking.
I know many people do not do that because they do not do that because they feel they would be outcasted as people who are using AI and not being not using their own intellect for writing the paper.
That's what I want to know, because
that's why journals are asking you to be transparent about it.
No, but they are. Then how do we make out? Because you are advocating people, but they are not. They'll not be doing it. And how many percentage you really find it?
So they do not do this only because they think it will be considered unethical. Now when the journal bodies are saying that just disclose about it, tell us what you used it for.
And also I'll tell you. But 1 minute. But even if after this journal, do you really feel
yes, it will
that they'll still include? But what's your anticipation about it?
Yeah, I think they would include. I think it gives us power as authors to use AI. We know we use AI. We know all of us have tried AI, may not be using it for our manuscript, but tried AI definitely, right? Right? All of us have tried AI, and we don't say that we use it in our manuscript, right?
Given as a percentage, no, that percentage is there, no?
What 10%? There's no percentage. By ICMJ, there is no percentage. Even the 10% for plagiarism, that's a good question that you raised. That is for certain journals. There are journals which say we will accept 15%. There are certain journals which say we will not accept 5%. Then there are journals which say we will not accept any 1% also.
So there has been one editors workshop that I was a part of in online, and this was being discussed, the use of AI in manuscript writing. So most of the journal editors agreed with the fact that we do feel that use of AI helps in better shaped manuscripts, and that takes away their thankless editorial job of correcting the language. So the journals would, the editors would absolutely be more very accepting to the fact that you have used AI for language purposes. Having said that, once you have used AI and you are not disclosing it, and if it's even beyond the use of your language, your integrity stands at stake forever. So the point is that the software like Turnitin and other software, they have already incorporated tools of AI detection. So if the manuscript writing tools are developing AI, then the manuscript detection, the plagiarism detection tools are also getting AI intelligent. So once you have used AI and not disclosed in your manuscript, your stake lies at your integrity lies at stake forever, because this software of detecting plagiarism would only get more intelligent with time. It might not be absolutely AI detectable today. It is. Today, when I use it for detecting plagiarism, the AI component is also given. How much of AI has been used in writing this? And they would also say which component of AI has been used, like language or manuscript generation, the idea. This is detected, but it's not very foolproof as of now. Today, if you're not disclosing it, you might get away with it for now, but 10 years down the line, some editor, some author, some of your biggest critic or your hater would find it out with that plagiarism. So it's best to disclose, and editors are being very accommodating of what you are saying. If it's ethically okay, then they are okay with you using it and declaring it. That's the point.
See, the last line says it all. Non-disclosure of AI use is construed as misconduct, scientific misconduct.
Yes.
So ma'am, are there any guidelines which advocate the percentage of AI like we were discussing yesterday?
There's no percentage of AI. As long as you are being clear that you've used AI for this part and this part. You may use AI for generating a nice image, right? A flow chart or something. Just mention that you've used it only for
actually
comment
it goes
section
for
is
like
one
for
of the features
plagiarism
that
we
makes
have a set
YouTube so
percentage. So
unique.
for AI
There,
also
you
maybe
can
in
get
the
direct feedback from your
coming
viewers,
years
answer their
guidelines
questions,
should
and
come up with
overall
certain
create a
percentage
community
of
and
it all.
How do
conversation
you
around your
determine the
videos.
percentage then?
Of
I
course,
might
some
use
comments
AI
are
for
lovely and
idea
some
generation,
are
another
not.
person might
The good
use
news
AI
is
for
there are
image
tons of
generation,
features
another person
available
might
that
use
help
it
you
for
highlight
entire
or
text
moderate
generation.
So for
right?
now,
In this video, we're going to cover
percentage is
two main
collective.
topics.
AI
First,
plus
what features
non-AI
you can
is
use to help
generally
you encourage
20
more of the
or
conversation
25,
you want.
but it
And
is
second,
collective.
what
It's
features
not AI
you can use to
specific.
address hurtful
So
or inappropriate
20 or
interactions in
25
your
is
comment
also
sections.
journal
Promoting
specific.
quality comments.
Journal specific.
First,
Some
let's dive
journals
into
say
some
0%
ways you can encourage
plagiarism.
more of the
They
conversation
do not
you want to
stand any plagiarism. There are journals which say 15% is good for us. There are journals which say 5%.
So again, the editorial perspective, if you have like 15-20% of plagiarism, we would again go to the point, where is the plagiarism showing? Is it the introduction part? Because introduction part is generally shows most of it because it's not paraphrased well.
Yes.
That is where the hand-holding is done to kind of paraphrase it so that it doesn't look like plagiarism. But if it is from the methods and results part or discussion part, then it is taken more critically.
Yes. Also, adding to that about methods part, you have seen a certain study where the methods were very clearly written and you are following similar thing. Can you copy the same text and write it? I would say yes, you can. You do not need to reinvent the wheel, but you should cite. We don't usually cite in methods, but you can cite if you're using the exact methods of another study, right? Like for example, the vast pain scale. Why do you want to write everything about the vast pain scale or the Apgar's score of newborn babies? You don't need to write the entire thing about Apgar scoring. You just need to mention we did an Apgar scoring and give a citation of what the Apgar scoring means, right? Okay, now Council of Science Editors is also talking about diversity, equity and inclusion in scholarly publications. Then there are other guidelines also. ICMJE also talks about diversity, equity and inclusivity. Very quickly, it just means that give everybody an opportunity to be the author, if they deserve it. Don't pull them back because they are females, because they are non-clinical, from the non-clinical departments, because they are from a different ethnic background, or because they are not from a high-income country, right? Don't pull them back. Any questions on ethics? I know I've been very detailed, but any questions? If you don't have any questions, I'll ask you questions. Yeah, anybody from the back who has a question on ethics? Okay, I'll put questions. Anybody who has answer to this question? Okay, a disclosure here, all these ethics questions are from quizzes from the internet. This is from Elsevier's ethics quiz. Anybody who can answer this? You are preparing a paper that involves a complex concept, but you are having difficulty putting into words precisely how this concept works. You see an excellent explanation in another published paper. Is it okay to use this explanation word by word in your paper without referring to the other paper? No. We all agree to that. You need to cite it, right? Let's say you don't copy someone's original work word by word. Instead, you paraphrase it. Is it acceptable to use someone else's concept, idea, or description of an idea, but in your own words? Yes, that's a good point. We don't have a third option here, but yes, it's not black and white. There is, you need to give the citation. You need to acknowledge the original source. Question number 3, this is from the Springer Publication and Research Ethics Misconduct Final Quiz. Which of the following constitutes plagiarism? And many of these do. Taking a graph published in Nature, modifying it, placing it in your article fully cited but without asking permission. Can you use it? No. Permission is required. Any different views from the back? Do you need permission to use a graph published in another manuscript? Or you can simply cite it and it should be fine. Anything? No? Citation is enough? Permission is required, yes. For images that you use, you need to cite it as well as seek permission. Sorry.
Ma'am, but if the copyright is not provided to the publisher?
It is with the author, right?
Yeah, it's with the author.
You need permission from the author. You need copyright. If anybody has a copyright, you need permission from that person. From that identity, whether it is a publisher, whether it's a journal, whether it is the authors, you need permission. Right? Creating an article, a large part of which has been cut-pasted from Wikipedia without attribution, because Wikipedia is not a journal. So can you copy and paste and not cite it? Can you use anything from Wikipedia in the first one?
Have proper reference. Wikipedia it is not allowed, I think.
Wikipedia पे भी हम कहीं ना कहीं सोर्स से आए हैं, तो ओरिजिनल सोर्स को साइट करके जाएं।
ओरिजिनल सोर्स को साइट करते हैं। अगर ओरिजिनल सोर्स नहीं मिलता, किसी का आइडिया है जिसने विकिपीडिया में डाल दिया है, फिर भी आप साइट कर सकते हो, बट साइटेड इट एज अ ऑनलाइन रेफरेंस विद एक्सेस डेट, बिकॉज इट माइट चेंज्ड। By the time it is published, the person might change the fact there, right? Then reproducing the material and methods section verbatim from your earlier article without citing the earlier article, that we have explained now. Then including quotation from another article with full citation but without permission.
Yes, quotation can be done because
Quotation, as long as you put it as a quotation within quotation marks, you can quote it. You don't need permission for quotations. Right? Then writing 2 articles based on the same research with similar findings but each written differently with a different title. Not with the similar findings, right? But there are many people who do that and they change the authorship order also. Same group of authors, but authorship order. Then this is one. Which of these statements is true? All kinds of human research needs ethics committee approval?
Yes.
Is that true? All kinds of human research needs ethics committee approval. Interventional, yes. Interventional, yes. But all kinds of human research, ma'am, what do you want to say about this? The first one. True or no? All kinds of research, human research.
If we are not taking approval, we have to take the exemption from the
You need to take an exemption. If you are not taking an approval, you need to seek an exemption
From the
ethics committee.
The case would go to ethics committee.
It has to go to the ethics
If it
committee.
involves humans or animals and
Animals or humans, it needs to go to ethics committee. Right? I am doing a survey, questionnaire, survey questionnaire. No intervention. No observation.
it will go to ethics committee.
Doesn't have to. Doesn't have to. Only in institutional research. You are doing a CAPA study, right? Knowledge, attitudes and perception study. You don't need an ethics committee approval for that. You need to mention why you don't need it.
They say that
Yes, you need to mention why you don't need it.
no, but then the committee would say that this we have seen it and you do not need ethics approval.
That is for institutional research. Like if it is a small, it's a small clinic. Individual level. I'm talking about an individual level. You are an MO. You have worked on a few cases. You want to publish it. It's human research. But you have not done any intervention beyond the standard. Without an institutional ethics committee approval, it's not on. Sorry. Yeah, without an ethics committee approval, you can go ahead, but you need to mention while submitting why you did not seek an ethics committee approval. But if you are in an institution, you need to have an ethics committee approval. That's the institutional guideline.
Ma'am, one question here. In our OPDs, in patient areas, suppose you want to do a short-term survey for 3 months, taking a sample of 200 patients.
Yes.
Only survey.
Yes.
No intervention. With the help of a set of question. So can we proceed or we need prior ethical approval?
I think for surveys where you are not doing an intervention, you don't need an ethics committee approval as long as you mention during the submission why you did not seek ethics committee approval. Because even if you had to send it to an ethics committee, they would say that you are exempted from an ethics committee approval because this kind of study does not need an ethics committee approval. You can go ahead with it. But as an institution, the institutional guideline says that any human research, you need to reach out to the ethics committee. But as an individual, as a clinical practitioner, you may not need to go to an ethics committee.
Okay.
Right? You have to decide who your... sorry, you have to decide who your audience is. Are you writing to create an impact with the clinicians, with the policymakers, or to create an impact for the patients, right? Who is your ultimate audience there, right? And journal fit, you have to look at many things other than just the impact factor. I'll come to that. When you plan, I would say a very good idea is to start with one line takeaway message of your study. What is the one line way in which you would explain the results of your study? Then it will help you build the report. Right? How would you tweet it if you had to tweet it? Right? Then first is title, because that's what readers see first, or even search engines see first. Then the abstract. Then think of clarity over complexity. Just because we are scientists, we do not need to write as in complex language. We need to write it clearly. Then create a structure for your storytelling, right? Whether it is a review paper or a research paper. Title optimization. Remember that title decides how your paper is going to be indexed, how it is going to be searched, how often it is going to be shared, or how it is going to be cited. This is an example. How would you rate on a we use the framework we use is Pico, right? There are on it maybe. Yeah, I is intervention. What intervention are you studying? C is comparison. What are you comparing it with? O is outcome. What outcome were you looking at? S is setting or study design, anything, right? T is the timeline. Whether you did a 2-year study or you did a 5-year study or a 2-month study, right? This is another example. A study of exercise in diabetes patients. Okay, I know P here, but I don't know anything else. Very bad example.
1.5.
This one? 0.5. How is this? This is a published article. This gives you all the PICOs. We know which is the population, which is the intervention. Right? So try to include as much information as you can in your title so that it is read. Right? We heard yesterday that your title should not be a declaration, but this is a declaration.
So, ma'am, in a lot of cases in journals, we still find, especially in European journals, that they tend to publish more articles with catchy titles.
Yes.
Yes. So those catchy titles, they definitely do not follow the PICO. That is there. Yes. But yes, they are getting published and everything. So like, is there somewhere, some balance?
So yeah, catchy titles still increase visibility, right? It increases visibility and citation. How does it do that? How is it indexed? It is indexed based on the keywords that they choose, the strategic keywords that they are choosing, the way they write their abstract, right? Or the tables and figures that they have used in the picture, manuscript. Before we go to read the entire manuscript, we usually look at the pictures, right? What figures have been used there, right? So there are different ways to strategize. But yes, for beginners, this is a good one. You could use PICOs or PICOT. Then abstract. So abstract increases your findability because after the title, one is going to read the abstract. Just skip this to save time. So don't write a vague abstract. Be very specific. I just skipped the examples to just cut down on the time. Then quantification. Don't just say that this improved, but how did it improve? How much? What percentage of patients benefited? What was the difference between the two groups? right? The examples I provided previously, I had talked about CI and effect size, so it is mentioned there. Then relevance, be clinically meaningful, how it is going to help clinically, right? Mention the clear purpose of the study. Then the key methods, main findings. You don't need to go into the secondary findings here in the abstract. And why your work matters in just one line. Conclusion, we don't have a discussion in the abstract. Tips for writing is write it last. After you have written everything else, you know what is the most important thing in your paper, so write the abstract last. Keep it as standalone so that when you read the abstract alone, you should be able to make an understanding of how rigorous this art study was and whether it was relevant or not, right? And also follow the journal guidelines. Some journals may allow you 300 words abstract, but there are journals which do not allow you beyond 75 words. So you have to check the instruction to the authors. Then common errors in abstract, where sometimes there are no abstracts submitted and the authors, the editors ask you to submit the abstract. There is too little information or too much information. Too vague information. There is information, but it's vague. It's just saying that it improves. How does it improve? You do not know, right? And too much of background information is not required. One line aims and objectives is fine.
Still go for unstructured abstract also. How about it? There should be a policy on for, because unstructured abstracts are never that visible and readable.
Yes.
So even still, many of the good journals are still advocating that unstructured abstracts. So what's your take on that?
Even in unstructured abstract, you have to have a flow, logical flow. You need to say first why you did the study, what you did, what you found, and how it impacts. Right? All the questions, need to be mentioned. Answered in the abstract.
But वो eye catchy फिर भी नहीं होगा जो एक structured abstract.
तो आप अगर structured दोगे, I don't know too many journals which say no structured abstract नहीं चाहिए. But there are now many journals which are saying आप जैसे भी structure दोगे हम ले लेंगे. But final stage में आपको structuring करना होगा. There are many journals now which do not ask you to, make a lot of changes during the submission. In the final stage, they come to that. Formatting is not required too much. Okay. This is another thing that I've seen in many abstract. They copy the text from the main text and then put it together in the abstract. Abstract has to be written separately, not copy from main text and put it. Keywords, what is that? Mesh. You are all familiar with mesh terms. So mesh is how the NIH librarians put different articles into different subheadings, medical subheadings, right? So even if that word is not used in your manuscript, they will put it in the certain subheading, right? That is mesh. So ideally, if you are using keywords, try to use mesh keywords. Then they know where to put it. Right? Then choose specific terms. You can use phrases as keywords also. Then think like the reader. How are you going to search for such an article? That's how you're going to put the terminologies there for. And do not repeat anything that you have already mentioned in the title. Right? If you've mentioned diabetes in the title, you don't need to mention it in the keywords. Because you are, not utilizing the number of words you could have actually used. Right? Title is anyway indexed, so keywords are also indexed.
So intervention, if you have mentioned the intervention, the title would not be...
Not necessarily. This gives you more, mileage if you don't do that. Because both things you can use as search. The search engine uses both the title and the keywords for searching. So if you want to repeat it, you are just losing on the opportunity, where you could have added more keywords.
In fact, of late I have realized that we in homeopathy papers should be always putting CAM as the keyword. Complementary and alternative medicine, because that will bring us into a broader bracket of CAM paper. Sometimes we only limit our studies to homeopathy and we do not even use the word CAM in our paper and in the keyword. Yes. We end up being searched, in many key search engines, because our keyword does not mention CAM.
Yes.
So that's one very big reason why we're losing on visibility. It's only a new recent learning that I have done.
Yeah, I agree, because when I was searching for examples, When I started looking for homeopathy as a keyword, I did not find too many articles. But had I used complementary medicine, I was finding more number of articles. And I could then see, okay, this is a homeopathy article. Because it's talking about dilutions. So when it is talking about dilutions, it is obviously an homeopathy article. For the number of keywords, do check the journal guidelines. Sometimes journal guidelines tell you not to use mesh words. Sometimes they tell you to use mesh words. Why not to use mesh words? Because the NIH librarians will anyway use their own intellect to put it in the certain mesh terminologies. So this is a journal specific thing. And the full story, how do you write the story? This we are all familiar with. But just remember that when you are talking about the introduction, it should talk about why you did the study. Right? And don't make your introduction too long. The longest part of your manuscript should be your study. So methods and results should be the longest parts. Right? Introduction should not be too long. As Indians, I find most Indian authors tend to write long introductions, a lot of literature review and all. That's not required. Come to the point as soon as you can. Right? Then in the introduction, do mention in the last line, what is the bigger objective of your study? Why are you doing the study? Not the clear, scientific objective type. But the last line should mention why you are doing the study. So that then I go on to the methods to see how you did that study. Right? Then methods talk about a lot of details. I would suggest go to the Equator network and find your guideline, your specific guideline, and use that guideline to write the method section. Right? Then results. Describe the results and don't interpret the results in the results section. Don't say what the results mean. Just mention what the results show. Right? And do not repeat what you have presented in the tables and figures in the text. Just one line interpretation of the table is enough. And then give a reference to the, write something and then say table number 1. Then you go to, the reader will anyway refer to table number 1 and see what that means. Right? Or table, figures, illustrations. Now, how to decide whether to use a table or a pie chart or a bar graph to represent a data. Right? I would suggest not to use pie charts in your manuscripts. Ideally, pie charts are used for 2 to 5 variables, not more than that. Right? Because it gets clustered and then you don't get to see the actual percentage. Right? And pie charts take up more space than the text. If you are talking about percentage of males and females in the study, you don't need a pie chart. You can write in one sentence. So don't use a pie chart. During your thesis, master's thesis and all, you would have used a lot of pie charts, but don't use pie charts in manuscripts, right? What about bar graphs? Yes, you can use bar graphs. You can use line graphs. Now, how to decide whether to use a bar graph or line graph or to use a table? When the numbers are important, use a table. When the trend is important, show a picture. Use the bar graph or the line graph or something else to show the picture, right? Now, in results also, just make sure that any objective that you have mentioned in the methods, you have a corresponding result in the results section, right? You may not put all the results in the abstract, but all the results should be there in the results section. And discussion, you discuss only the key findings. We are not going to discuss all findings in the results. In the discussion section. Only key findings are discussed in the discussion.
Challenges of the
Sorry?
Plus the challenges and the limitations.
Yes, the discussion of the main findings. What you found and how it compares with the other studies and what are the strengths and limitations. Why should you write about the limitations? Isn't it a negative thing? When you write about the limitations, the peer reviewers understand that you know about your limitations. And it's actually positive to write about your limitations. Sometimes we don't know the limitations of our study. It's good to think about it, put some effort into it, and then write the limitations. Right? It could be the study sample size, or it could be the study design that you took was a limitation. It could be that, you expected 100 people to respond to a survey, but only 50 people responded. That is a limitation, so you can discuss on that.
Would you be taking a...
Okay.
Can you wrap it till 12:50?
Yes,
I was supposed to start.
Sure. Okay,
Social media, we can skip to.
Okay, sure. Okay, so this is something that you're aware of. This is one thing that I wanted to discuss, Dr. Harley, because this is something that I'm sure you find a lot also, right? This is the way people write their introduction and discussion parts.
Yeah.
You should not write it like a literature review section of a thesis. It should be a synthesis of the literature. You found these literature, and then what they mean, and just give the citation numbers. Don't write this, author and all, they found this, they found, A et al. Found this, B et al. Found this, C et al. Found this. But together, what is the synthesis of the literature that you found? This I have already discussed. Okay, this you can take a screenshot. I will not go into details of this if you...
Share the PowerPoint, if you're okay with that.
I can share this slide, this particular slide. This is important. No, not the entire PowerPoint. Okay, then publication extenders, we wanted to discuss about this quickly, right? Yeah. So publication extenders, how to increase the visibility of your publication. One is to choose the right journal. We'll talk about it. Preprint servers, we've already discussed why you need to put on preprint servers. We'll talk about social media, blog posts and personal website, podcasts and webinars, graphical abstracts, video abstracts, and plain language summaries. Right? Why do you need to be selective about the journal? I'm not going to talk about that. You know that you need to be selective about the journal, right? When to choose the journal? Choose it as soon as you can. You can modify later, but choose it right at the beginning. Then you write the paper according to it. Otherwise, you have chosen a journal which accepts articles which are like 5,000 words, but you then decide to send it to a journal which accepts only 2,000 words. Then you are stuck, right? And your journal selection is your own shortlist. It's not somebody else who will tell you how to find the journal that you should submit to, right? You may choose a Mercedes, you may choose a Maruti 800, it's up to you. What is your convenience, right? Consider your study. Your priorities should not be based only on you, it should be based on the organizational policies, the research team as a whole, or the type of study you are writing about. Scope. Look at the journal's instruction to see whether your article fits that journal scope. If it doesn't, they will give you a desk rejection after you submit. Types of articles they accept. Some journals do not accept case reports. Check whether they accept case reports or not, and then only submit to them. Otherwise, you will be wasting time. Language. You need to check whether they accept English. For us, this is not an important thing. But there are many international journals with very highly cited articles. You will find English abstracts, and then when you submit it, they say, no, we accept only Spanish articles. Then the peer review process. What is the peer review process you are comfortable with? There is no right or wrong peer review process. Some journals have a blind peer review process where both are blinded. The author doesn't know who the peer reviewer is, or the peer reviewer doesn't know who the author is, right? In some cases, the peer reviewers know who the author is, but the authors do not know who the peer reviewer is. Right? And then there is another process which is an open peer review where the authors know who the peer reviewer is, peer reviewer knows who the author is. Another hybrid method is initially the authors do not know who the peer reviewer is, but journals take an undertaking from the peer reviewer that once this article is abstracted, would you like your name to be associated with it? So we can give a consent that yes, you can have my name published. And I can give as a peer reviewer, I can say whether my report will be published along with it or not. So sometimes when you are that transparent, it helps science as a whole, right? But you have to decide what you are comfortable with. Then indexing database, where do you want your article to show up? You have to decide whether you want a PubMed index journal or you want a Scopus index journal. What kind of indexing agency is better for you? Publisher and country, you want to publish. There is nothing called an Indian or an international journal like we discussed earlier. But whether you want to publish in a journal that is published from Pakistan, or you want to publish from a journal that is published from Turkey, you want to publish in a journal that is published somewhere in the US. right? Chances of acceptance and rejection. Do look at that. Many journals on the website mention what percentage of articles are accepted. That gives you an understanding whether you want to send it to your to this journal or not. Periodicity. How often do they publish? If a journal publishes once in a year, there is high chance they will reject your article unless it's a very critical article. Having said that, Lancet publishes every week, but it does not select all the articles. It has a very high rejection rate of around, I think, 95% articles are rejected by Lancet. So you have to decide based on the merit of your study where you should publish it. Response time, how quickly they respond to your comments, your submission. Do they send you a desk rejection right away if they want to reject, or they wait for 3 weeks and then tell you it is rejected, right? Then instruction to authors, look at the instruction to authors, word count, abstract references, how many references are allowed. Some journals will not allow you more than 30 references in an original research paper. They will not allow more than 3 references in a case report. Some allow 10 references. So you have to look at that. How many tables, figures, and legends are allowed in an article? Then IMRAD distribution. What percentage of the entire text can be the introduction or the discussion? What are their policies for data sharing? We talked about data sharing databases yesterday. Now, whether they want you to give a data sharing statement right at the beginning, or you can give a data sharing statement saying that in case somebody needs the data, you will be sharing the data. You can do that. Post-publication sharing. So you must see what they have. And multimedia, do they use video abstracts? Do they have, graphical abstracts? Do they allow color publications of images? Right? Then the plain language summary. Some journals ask you mandatorily to have a plain language summary for the patients. Right? Then journal policies about APC. What is the article processing charge that they have? How much do they ask you? Is it wrong to collect APC? No. Somebody has to pay for open access, right? For the journal to run, somebody has to pay. Either the author pays or the reader pays. If you want readers to read your article, you have to make it free of cost for them. Now, free of cost can be of many types. Either the author pays or the publisher pays. Right? And the publisher is funded by a funding agency. Or there is an association which is paying for it. Now there are journals which take advertisements also. So you have to look at the APC. What is the APC? Like if I had to submit to JAMA, it asks for an APC of $2,000. I cannot pay for that. So I might just skip JAMA for now. If I had to submit to AnyJM says if you want it open access, you pay me $2,000. I will not pay $2,000 for open access, but AnyJM says after an embargo period of 12 months, your article will be free of cost to others. Right? So you can decide you want an embargo period or not. Like what is the journal policy about preprint and about ORCID also? How many people are familiar with ORCID numbers? You're familiar, right? So some journals insist that you need to have an ORCID number, but many clinicians do not have ORCID numbers. Right? Then who's the target audience for that journal? Is it circulated only in India? Is it circulated worldwide? You can look at what kind of access you want. Accessibility is open access and paid access. We talked about that. Impact factor, ma'am is going to talk about it. I'm not going to talk about it. And versions. Does the journal have only an online version or a print version also? Earlier, MCI was saying that you cannot have online-only journals considered for your promotions. But now it is more flexible. Other points you may want to consider when it started publishing. Is it an old journal or a new journal? When was the last issue published? Are they regular with their publication or not? Right? So this example I gave you that, April 2019 we submitted it, but it got actually published in January 21, even though they had accepted it in 2019. Right? So some things are unpredictable. This is an example I wanted to show. This particular journal shows that the impact factor is 0.35. If you go to JCR impact factor records, you do not find that journal mentioned. Right? So you have to be very careful about what the journal website mentions. Think, Check, Submit, ma'am discussed yesterday. Go to thinkchecksubmit.org. It gives you certain tips of what to think about, how to check, and when to submit. Open access, this I talked about, so I'll just skip this. This is a preprint server where you can publish your article before it is actually peer reviewed and accepted. Right? So this is preprint server, the author submits it there. After that, this was again accepted and published in a journal. Once it is accepted, you have to link it back to the preprint. The last line says now published in this journal, and this is the DOI. This is another preprint. So this is called preprints.org. This is by the Open Science Foundation, OSF. So you can submit your articles there also. India also has an India RXIV, but I did not find any homeopathy example there. You might be the first one to publish a preprint homeopathy article on India RXIV. And OSF is Open Science Foundation. You can have visual abstracts for your articles. When you have a visual abstract, people tend to cite it more often because they tend to read it more often.
And some journals have a
mandate to
that you produce a graphical abstract.
Graphical abstract, yes. Then you can have a news article based on the publication. You can have a video abstract also, right? Video abstract, yes. It's on that same journal's website. They have a video abstract for this particular article. Right. It could be an animated abstract. It could be an author talking about the particular research. It could be anything. Right. This is an animated abstract with the pictures showing also.
We also have video publications.
Video publications, I'm not aware. Video abstract.
Also getting published as video documentaries or video publications. That's what I came.
Full research articles?
Yes.
Okay, I'm not aware. I will have to check on that.
I don't know what exactly. I'm not able to recall the term.
Okay. Video podcasts are there. Video abstracts are there.
And you get something, some word.
Yeah, even this video abstract has a DOI. I cannot show you because the screenshot is very small, but it does have a DOI that you can cite. At the bottom, I'll just go there and show you. At the bottom, there's a DOI which mentions that you can cite it like that. Then if you go to the journals, they may have a guideline for how you should prepare the video abstract, right? And video abstracts are peer reviewed. Right? Video abstracts are peer reviewed. Studies show that video abstracts are, the articles which have video abstracts tend to be cited more often because people do, go through those video abstracts. Then this is another social media for researchers where you can post articles. Right? You can post preprints. This is a preprint article posted on ResearchGate. Anybody who's using ResearchGate? Anybody here we are all using ResearchGate, right? So yeah, post on ResearchGate about your article. Start a discussion about your article. Don't just post, right? Then this is ResearchGate article. The other one was a non-peer reviewed one. Then you can have, the full text uploaded on ResearchGate also so that people can read it more. Or you can add the DOI so that they download it from the website. When they download it from the website, the alt metrics increases.
No, but then full text only if it is an open access.
Yes.
Otherwise you cannot.
No, even if it is an open access, I will suggest not to put the full text here, but to put the DOI. Because when you put the DOI, this is a strategy. If you put the DOI and not the full text article, the person will go click on the website and the journal gets a extra view or download and your alt metrics increases.
Yeah, generally what the practitioners are doing, generally the scientists are doing, they are downloading the PDF version and post it in the WhatsApp group.
Yeah,
so that this will be circulating.
So they are doing that, sir, but the strategy is share the link, not the PDF. Share the link on WhatsApp groups so that your own alt metrics increase. Right. Even on ResearchGate, if if you don't add your article on ResearchGate, and if it is an interesting article, I get many, requests for sharing the full text, and then I share the full text through email to that particular researcher.
But if it is open access, then how can we do that?
Open access, you can.
Like, no.
Paywall bound, you can. No, then we don't. No. If it is behind subscription, paywalls and all, you cannot. LinkedIn posts. You can write about your article, right? Discussion about your article. This is about an author's publication. I don't know if you know these people. I don't know these people. I just downloaded from LinkedIn, did some research. This is from a bariatric surgery, symposium that I went to recently. This particular person had written a long post on what he was doing and how the publication was helping, and with a strategy to tag all the co-authors, so that anybody who follows those co-authors is also seeing this. Adding hashtags also is a strategy. I think the previous one had added hashtags. This author has added a lot of hashtags. What search terms people will use to find your article, right? And they have also provided the link of the article so that it is clicked. This is one where you go and talk about your article at conferences, and then also promote that conference and the article through LinkedIn. And not just LinkedIn, you can use Facebook also to promote it. Facebook now has a professional dashboard also. Sorry?
He's saying that he only knows the person on the side that doesn't know the people on the side.
Okay. The people on the sides are here. You can meet them and interact with them and get to know them. Okay, so on the university pages or the institute's pages, or even CCRH, if it has a LinkedIn page, you can post about the publications you're doing, right? Every time you post a publication, you can generate discussion around that publication, right? Post it on authors' websites or authors' pages. If you don't post it on authors' pages, but you want to post it on the CCRH page, then tag all the authors, right? And you promote my article, I promote your article. That is a strategy, right? Just a discussion. You are not saying this article is great, but you promote a discussion around that topic. And the more we discuss, it becomes more visible. Then you could create podcasts. We talked, Dr. Albina talked yesterday about the podcast she is running. Similarly, your homeopathy journal can also have a podcast. Even if the homeopathy journal does not have a podcast, you could talk about the article that you have published in other podcasts and promote that podcast, right? It's basically a collaboration between the person who's doing the podcast and the author. This is an X post about their article. Then you can have, articles posted on blogs. This is the journal's blog, but even if it's not the journal's blog site, you can create your blog site, talk about your article, provide a link to the article. Wherever you talk about your article, it is very critical to provide the link of the article so that it is read. Key takeaways: have a strong manuscript, but know how to write it better and how to promote it. Thank you. And so now I'm promoting my articles. This is from my Google Scholar page. Thank you so much. And sorry to have taken so much time, Dr. Harley. I overrode into your session.
I don't think sorry is the word that you should be using for such an insightful lecture, ma'am. It has been absolutely wonderful to have you and to have such an elaborate talk on, these topics, they sound very basic, and I think ever since we have entered the research field, we have been kind of hearing about all this. But as I mentioned at the beginning, you can never have enough of it. This is something that you need to keep on going back to basics to kind of see whether you understand it a little better now, after a couple of years, after 5 years, 10 years. You keep revisiting these concepts to to see whether your maturity to understand the subject has increased and towards.
Also evolving, and it's also evolving. Like 2 years before this, if you talked about AI use in publications, everybody would have said, no, it's unethical, don't do it. Right. But now even the guidelines are changing.
Yeah,
right.
True. So, ma'am, we are very, very thankful to you for all this. I am afraid we do not have many times for questions, but I think the session itself was so interactive that a lot of questions and discussions happened during the session. So still, if we have a burning question here, somebody who is really itching to ask something? No? All right, that only is kind enough. I think it's the right time, ma'am, to felicitate you formally as well. And I request you to be on the stage, and also Dr. Muralidharan, please join us on the stage to felicitate ma'am. So a big round of applause for Dr. Natasha Das. Dr. Santosh Tamang, please join us. She's been a very enriching, she's given us a very enriching talk, and I request Dr. Muralidharan sir to please felicitate ma'am with a khadas. Khadas, sir also. Khada, only khada. I'm so sorry, I always keep on mispronouncing it, so I didn't want to go wrong. Right, thank you ma'am. Yeah. So, ma'am will not be sharing the PowerPoint, but we do have the live recording in the YouTube that we shared in the group. So we can keep revisiting that to clear our doubts in case we have some doubts in this. And then, of course, ma'am has shared her email ID as well.
And
right.
I would encourage you to join me on LinkedIn for such discussions. I discuss this quite often on LinkedIn.
Yeah. No wonder you topped the chart of who to call for medical writing sessions. So we know now why.
You use the strategy.
I used the strategy, yes. Right. Thank you. It was just being at the right time with the right people. Thank you so much. Would that be a formal beginning of the next session, or somebody wants to call me again? I think we can cut. I think everybody knows me, so I think we can just get done with it.
Hello. It's my privilege to invite Dr.
For the YouTube. Okay.
For the last session before lunch. So I'd like to call Dr. Harleen Kaur for her session. Please be seated. We'll be finished very soon. She's very interesting, and you can ask many questions as much as you can. Thank you so much.
I sent my pen drive, my presentation on you. You have it? Oh, yes.
Thank you. So I will not. Sorry? Okay, pointer. Thank you. How are you pointing at? Is this ना?
ये हो गया pointer हो गया.
बस वही चाहिए. अच्छा, ठीक है. So there's a lot that we have been hearing since last 2 days for journal metrics, and it is something that is rather new to all of us. And it's just not all of us, it's actually a very new concept. The only metrics that existed, for a long time was impact factor, but that's actually a thing of past. It's very much used still, but there's too many to make IF also look small. So that's what we'll see, how it is and how we should be dealing with the complex building of journal metrics. And in the end, I will quickly take you through the CCRH and its work and scope. So there is an evaluation paradox. We like the papers, like our papers are evaluated, like the scientists are evaluated, the journals are also evaluated, and as a research writer, as a researcher, we do need to understand that how our journals are evaluated. It's very important because if the journals are evaluated, if there's a set parameter, then your papers will pretty much go to the same evaluation. So the journals and the papers, so they are kind of interlinked.
So scholarly publishing has grown exponentially. How do we measure the quality of a paper, research, or a journal? You are where you publish. The power of prestige. So this prestige is only become more important as to what you choose to publish and where you choose to publish. So the citation metrics has actually evolved. We can go back to the time of 1955, where the scientific community, and specifically Mr. Eugene Garfield, realized that citation indexes for science it's something that needs to be discussed upon, and the foundational vision for linking scientific thought to citation was conceived. And in the 1960s, there's an Institute for Scientific Information that started formalizing data collection and analysis. So it's in the 1960s only that there was a realization that all this scientific production that is coming up has to undergo some analysis and some parameters for assessment and quality. And in the 1975, you have Journal Citation Report, where the standardizing of journal evaluation starts. And in the 2000s, you have launch of Scopus and its associated metric CiteScore. Scopus does have a lot of other metrics nowadays, but it was the CiteScore that it launched in the 2000s, which was the first metric by them. And it has eventually diversified. And again, then you have something which is very new, very novel, but again, equally important, which is altmetrics, which captures real-time research impact. So you publish a paper today, and your altmetrics start happening right away. So a metric is only as good as the underlying database index. In fact, so if you have not really chosen the right journal, then your paper is going to suffer because the decision was bad. And why are we talking so much about journal metrics being linked to citations? I mean, there could be so many other things. Why do we eventually end up talking about only citations when we talk about metrics? That's because the whole scientific publication is about citation, and citations represent a formalized acknowledgement of intellectual depth. So, just in case, you forget to bring your pen to your college class one day, and you take a pen from me. So I do have a pen, but you were able to make your notes that day only because I lent you a pen. So it's a debt. So you kind of are in gratitude that I was able to hand you over a pen. Similarly, we say that there is an intellectual debt that we owe to people who have worked on the similar fashion or similar subject before me. So when I talk about their work, I owe an intellectual debt to them. So the moment I cite them, I've kind of paid my intellectual debt to them. So that is how the whole story of journal metrics starts. So that is why it is so intertwined with the citations. Just have an overview of key players in journal metrics. Who are the key players? Of course, we all know the impact factor. The player behind it is basically Clarivate. Clarivate is an information services provider, owns the Web of Science platform, and manages something called Journal Citation Reports, which generates impact factor. So it's basically Clarivate's outcome through JCR reports. And then you have Elsevier, and it has its own, it is a leading scientific publisher. It owns and operates Scopus. So mind you, Elsevier does not have a metric of its own. It is through Scopus that Elsevier would produce metrics. Right? So Elsevier is a key player, but it's one of the solutions. So we sometimes mix this up. That's why I've taken it as a separate player, even though it plays through Scopus. Scopus is the world's largest database when you talk about the number of journals that it would cover. So Web of Science is basically more about the science, the medical science, and the technical science, Scopus is all academia combined into one. So it has maths, architecture, and everything. But Scopus has a lot of medical database also. And it is owned by Elsevier, tracks citations across thousands of journals and publications of its own. Only of Scopus index journals. So if a journal is not Scopus index, but is Clarivate index, it would not come under Scopus scoring. So you have to understand this. PubMed index journal or the Clarivate index journal would give you an impact factor, while a Scopus index journal would not give you an impact factor. And then, even though there would be some journal websites you would see, they do not have a Clarivate indexing, they would still mention an impact factor. Either that is a flawed figure, sometimes this could be also an arbitrary figure, which kind of correlates to their site score. There is a way of doing it as well. Google Scholar, a freely accessible search engine for scholarly literature, indexes academic publications, including citations, but I'm sorry to say it's not your best bet when it comes to metrics, when you come to indexing. Google Scholar has a lot of noise coming in from here and there, and until a scientist is very particular about how the profiling is happening, the scoring that Google Scholar would give you is generally it should be taken with a pinch of salt. Right. So let's particularly talk about JCR and impact factor here. So JCR is the official platform where the impact factor is calculated. Where is this? Why is this not coming on the screen? I'm too bad at pointing laser then. It's not coming on the screen for me. It's only going on the ceiling. Oh, I cannot handle it, sorry. Okay, so JCR is the official platform where the impact factor is calculated. I think most of us know how the impact factor is calculated. And it is primarily a metric that is used to rank journals. And JCR would declare its annual report every June. And the way it is determined is total number of times its articles were cited during the previous 2 years divided by total number of citable articles in the journal during those 2 years would give you an impact factor for a particular year. I would show this with an example. But the key word that we have to focus here is, how do you kind of, can you help me with the pointing? I cannot really point it. It seems to be going on the ceiling but not on the screen. Screen पे क्यों नहीं आ रहा ये? हाँ दूसरा दे दो. कल तो green वाला था. I think we have one more. So the focus that we have to pay in this particular concept is the citable articles. So the impact factor is, the denominator for the impact factor is not all the articles that were published in the last 2 years, which is to be pressed. Yes, पहले क्यों नहीं दिया? तो, but only the citable articles, which means they will exclude a couple of things that would help you probably make the denominator a little bigger. Next कैसे करेंगे इसमें? उसमें नहीं. So this is the example that we are talking about here. So now we are coming here to the site score, and then I will compare both for you. So over here we are talking about site score, which is a metric used to measure the citation impact of academic journals. It was launched by Elsevier in 2016. While the impact factor is based on the data from Web of Science, site score pulls the data from Scopus. So I think we as scientists have a lot of confusion about why this journal doesn't have an impact factor, why is this journal talking about site score, and we all always see, oh, this journal doesn't have an impact factor, so ye journal bekar hi hogi. So it's not like that. Some journals have site scores and some journals have impact factor, and then some journals have both. So this is not, there are reasons and there are bases of judging a journal, but this absolutely is not the basis of judging a journal, that a journal which doesn't have an impact factor is something that is not to be considered.
Yeah. And how is site score calculated? It takes into account 3 years, unlike the previous impact factor, which takes into account 2 years. And so if you're talking about 2015, so the site score of 2015 will be number of citations in 2015 from documents published in 12, 13, and 14 divided by number of all documents here. You don't have only citable documents. IF is very particular about this, that what will I compare the data with. Over here, it will take all the data into account and publish in the last 3 years. This is a clear-cut comparison for you guys to understand how are the site score and impact factor different. So, if you're talking about, a scoring in 2019, then over here, if we say about a site score, it is taking into account document from 4 years, and then for the 2019, it's for 3 years. Last 3 years in the 2019, and this is citable documents from 2 years. And then you have an outcome that would be telling you about citable documents, which includes only articles and reviews. So what are the citable documents that impact factor is going to consider? Only articles and reviews. While the site score would consider articles, that includes everything. Reviews, articles, conference papers, data papers, and book chapters. So this is how the denominator is also different. And that is why the scoring that comes out is also different. And the baseline data is also, the duration is also different. And if we look at major metrics, the major metrics that we talk about in journals today are JIF, Journal Impact Factor, then you have site score, then you have SNP, and then you have SJR. I'm going to come to SNP and SJR eventually in the next slide, and then you have JCI. JIF is looking into, site score has recently changed it into, there's a confusion of 3 and 4 years. They are now getting more broader, and they have changed the duration into 4 years now. So that was an old slide that I have just come up with here. So they're basing it on 2 years. Scopus is, site score is for 4 years calculation window. SNP has 3 years calculation windows. SJR has 3 years, and also JCI. And you can see the data sources. So you can see that Clarivate is giving you 2 indices here for journal. It is giving you impact factor, and it is giving you JCI, while Elsevier is giving you 3 databases, and these are the only basic ones I'm talking about. There's a range of metrics that we talk about, but then these are the basic ones. And let's come down to this particular column, where you have the key characteristic of each metric. Look at this now. Now this was something that we always knew, traditional gold standard. It is nowadays it's considered very raw. So what is raw? Raw is something that is unpolished, is not refined, it is not conditioned to the need and to the genuinity of the thing. So it is these days considered a very raw metric, while it is considered, Scopus site score is considered a more transparent, broader journal coverage metric. And then this is a very interesting aspect of a journal metric, which is called field normalized. So what is field normalization? Basically the metric would take into account which field you are printing for. So are you printing for something which is very widely reported, very widely cited, very widely researched upon? Or are you talking about a field which is limited to a very niche sector? In our case, homeopathy is still considered in research as a very niche sector. So unless you do some normalization in the metric, you would not really know how successful a journal or how credible or how accessible for the public or for the readers a journal is until you apply field normalization to it. Now suddenly, by knowing this fact, this factor, the SNP factor, becomes very important for CAMP journals and more specifically journals that publish homeopathy. And then you have prestige-weighted journals, metric, citations from top journals count more. Now if I have, for an example, one paper that was cited in Lancet only once. And I have another paper that was cited 10 times in 10 small journals. Should they get the same rank? Should the scoring be the same? Yes or no? Which is more important? One citation in Lancet or 10 citations in small journals? For the IF, the score would still remain 1. Here it will normalize with accordance to prestige. So that is why we have to understand these aspects. Now that we are becoming seasoned researchers or writers, these aspects also are very important. Then we have JCI. I would come to the full form in the next slide. I am kind of not very sure, so I'm not naming it yet. And we have a slide on it, and it is across all Web of Science journals. So this is the comparison of, it's a very interesting comparison, and I have particularly brought 2 journals that we all love, Homoeopathy and, come on, say it. Yeah. Why did it take so long to say IJRH? It should be the first thing in your heart. Okay. Right, so JIF versus CiteScore. Now let's see. Notice that the journal Homoeopathy, the CITE score for it is 3.0 and significantly higher than JIF, 1.3. Now can we understand why? Because impact factor, as we understand, is very raw. 1, it is taking into account how much years? Only 2. This one is taking 4. And then its denominator is, yeah. So GIF is a tighter 2-year snapshot. Over the 4 years, you are more likely to get cited as compared to 2 years. And also, it's been studied that homeopathy research papers have a slow progress. It's not that today you have published and in the first month you will be cited 10 times. Maybe in next 10 months, you'll be cited 1 time, which is absolutely normal and above average, in fact, for a homeopathy paper. So if you have a 2-year window and a 4-year window, you know that it is not something that, homeopathy is not going up because it's the best journal for us and just 1.3. Doesn't it sound a little not digestible? So let's have a new understanding and new approach to this. This 1.3 something is absolutely something that a homeopathy journal can be proud of, because our citation rate is very different from a medical journal, so we cannot really be comparing apple to oranges. So let's come to IJRH now. So the power of SNP. The IJRH has a CITE score of 1.4 but a SNP of 0.74. This SNP value suggests that while it receives fewer raw citations than a general medical journal, it is performing at about 74% of average citation potential of its specific niche. Basically, this goes to mean SNP is generally considered as 1. The good SNP is 1. So from 1 you compare. 1.4 means that you are performing 40% above the average of what you are supposed to perform. And 0.74 means you're close to getting there. You are 74% of the average of what a journal of your category is supposed to perform. So that is how the SNP is also very important for journals that publish homeopathy work. Sorry. So this is I just wanted to do a comparison with Lancet. I mean, who can stop you from being optimistic? So I thought, let me see if I apply all the metrics to Lancet and to IJRH, what comes as a comparison window? That is going top, but that's Lancet and IJRH. Now let's see how the scores vary. Raw impact factor, GIF, close to 9.98.4. Now this is an arbitrary impact factor. We do not have one. This is kind of corroborated from the CITE score. Just for the sake of comparison,
So some metric calculators would do that for you, even if you don't have one. So it's like if I get PubMed index tomorrow, if I get Clarivate index, what would my IF, immediate IF would be that some metric calculators would do for you. So I would come to 0.6. By the way, but Lancet appears to be 164 times more powerful in IF. Site score 15.3. I have a site score of about 1.4. We have a site score of 1.4, and Lancet appears 82 times more powerful. Of course, the value comes down here. Sorry, this value comes down here, and then SNP, which has normalized it to the terms of the niche, the sector that you're coming from, comes down to 25, and we are 0.74. Lancet is now only 33 times heavier. So I am just trying to make you understand the value of journal metrics and how it changes the whole game calculation. So it's one thing to say that we are not Lancet, but it's another thing to say that are we the Lancet of homeopathy? I'm just naming here not for the sake of any promotion, but I'm just, because in our heads, these are the names that would come up. So that is why I'm taking this as an example. So Lancet is now only 33 times heavier, and SJR, you come here, Lancet is high prestige, IGRH is solid for its niche. So, because SJR, this is a prestige, we talked about prestige. So since we are talking about prestige, again, how would an IGRH paper be cited in a prestigious journal? Any answers to that? Can I, as a journal editor, cite an IGRH paper in a prestigious journal? Can I? No? Then who can? Authors? And which authors? Who love IGRH? Do we have enough of IGRH-loving authors here?
No, but if novelty is there in some of the manuscript, I think that can be picked up. If the novelty is there, you are going to...
You said it. What I'm saying is, as authors of a research council, which publishes so much of research work, and which for some reasons, obvious and non-obvious reasons, does not end up submitting to IGRH their work, is it our accountability or our ethical responsibility to submit, if we are submitting to a prestigious journal, a relatively more prestigious journal, to kind of do this homework of finding out, scanning the whole of IGRH archives and see, can I cite IGRH paper in this very prestigious paper, submission that I am doing to this journal? If you are successful, IGRH is successful too. That's the game. Even if you're not contributing to IGRH by submitting your journal or submitting your paper, you can still contribute by citing IGRH. Yeah, so it's a win-win. Because I think we all do have ethical responsibility of making sure that IGRH becomes a more heavily cited journal. So that is what I was, when I said prestige. You can bring more prestige to the journal by citing this journal in a prestigious journal. Quartile, both are established index journals. We are Q3, I'm going to come to that. Now, a more practical comparison. I thought Lancet is the answer, but then let's compare with something on ground. Very good comparison here, this is. I think we would all love it. This is, I think, for the first time this profession is kind of putting this on board this way. But then, look at this. We don't have, it's an arbitrary score, 1.3, 0.6 globally. Homeopathy is cited twice as often, 6 into 2, 1.2. So we are cited half the times that homeopathy paper is cited. Site score in a 4-year window, the gap remains consistent. Still, we are like half of it. SNP, the gap almost disappears. How? Yes, because this is a field normalized metric. What they have done is, this is like homeopathy is behaving in its paper pattern, citation pattern, 80% of what a normal journal of its sector is expected to behave as, and IGRH is behaving 74% in the pattern as, a paper of its sector is supposed to behave as. Now you understand the power of a metric? Yeah, something. I think we can have an applause on that. Yeah, sure. This is us. We are all doing it. It's our journal. So why I'm giving you these practical examples is something, because sometimes we just get scared away with the word journal metric. We only see site score. I think abhi IF ke baad we have started seeing the site score also. Itna sensitization ho gaya. But SNP or SDR to abhi bhi nahi dekh rahe hum. So going by that, as DG sir has been telling, that homeopathy is the world, IGRH is the world #2 homeopathy journal. It sure is. It sure is. So, this is something that we can now talk in data as well. And then we talk about prestige. Of course, homeopathy is high prestige Q2, IGRH is solid Q3. We have remained consistent with Q3. I know we should be talking about quartile first and then discussing this. We can go in the next slide. Now, limitations. Why is JIF called raw? Basic problem with JIF. People might not see it as problem, but as a homeopathy editor, I would call it a problem, is that citation skewness. See this. The long tail on the right, the histogram visualizes one of the most important concepts in bibliometrics, citation skewness. In almost every academic field and journal, citation counts do not follow a normal distribution in every kind of metric that you have. Bell curve. Instead, they follow a power law or a long tail distribution. You see there's a long tail there. The clutter on the left, because it's absolutely normal that the vast majority of published papers receive between only 0 and 5 citations in their lifetime. In fact, for many journals, a significant percentage of articles are never cited at all. The long tail on the right, a tiny fraction of papers, the blockbusters receive hundreds or even thousands of citations. This is the elite few. More than 70 or around 70. The outlier effect, these few high-performing papers are responsible for driving up the average score of a journal. Would you not call something like this very raw? Very non-normalized? IF doesn't take into account all these factors. So this particular aspect, the long tail phenomena, actually gives you such a skewed data, and this is how IF is only taking into account the first 2 years. Homeopathy papers generally have a span of the first few citations of 4 to 5 years. How can we even compare it with a normal high impact factor journal? Schemago journal rank. I'm sorry for this small font. I didn't realize it's that small. I inserted this slide last night and I was myself sleepy, so I didn't realize it's not a good slide to be seen on the screen. Core principle, a citation is not just a citation. Schemago, SJR believes in saying citation is not just a citation. For IF, citation is just a citation. One means one. Here, they do apply some weightage to the system. A citation from a prestigious journal would count more than a citation from an obscure one. In a traditional system, if a student's blog and the Lancet both cite your paper, they are both one. But Schemago rejects this, right? Schemago logic is built on prestige transfer, the weight of the source. A citation from a highly ranked prestigious journal carries more weight than a citation from a low-tier journal. Neighborhood effect, this is very interesting actually. The way, the gossips travel. Similarly, the papers also travel the same way, So, if you're being cited by the leaders in your field, your own prestige increases exponentially. So, if you are being cited. But the problem is,
that doesn't happen too often in our very small circle. We don't really see that, okay, let me again cite this work more and more. So we have our reservations for citing a particular work. We have our own hindrances. Quality over quantity. A journal with 10 citations from top tier sources might have a higher SJR than a journal with 50 citations from low impact local sources. So यहाँ पे 10 citations का SJR will be higher than 50 citations in a low tier journal. So they would actually do that weightage normalization. No, quartiles is...
Take like which is prestigious. It is as per the quartile.
This is Scopus scoring again. They have actually given some prestige to... Quartile is one of the factors for sure. Q1 would be more prestigious, Q2 will be less prestigious. And how this quartile division, what this quartile division means, I would just tell you. Yeah. So, a citation from a prestigious journal... okay, I think we talked about it. So practical application for this is SJR has a there's again it's kind of a double-edged sword for homeopathy. Let's see how. Now SJR, because homeopathy is often cited by other homeopathy journals which themselves have low SJR scores. Who would cite us? Very few homeopathy researchers are first of all, homeopathy research is a very niche field. Very little research as compared to the medical research is happening in that. And then on top of that, homeopathy researchers ending up publishing successfully in a good journal is again, the chances are few. So we are cited, our citation rate and our number of people citing us is very low anyways. So this is a challenge. What is the opportunity? An IJH article is cited by a major integrated medicine journal or a high prestige pharmacology journal. SG of IJRH will drop significantly, even if it's only a single citation. At the same time, because we are such a niche sector, just one citation in a prestigious journal would would have a direct impact, direct bearing on the SJR scoring of IJRH. So it's a double-edged sword. We are cited less, but one good citation in a good journal would actually give a very direct, bounce back effect on SJR ranking. In short, you said it. We need a stronger neighborhood. And first, sorry, this is the mic. So first, actually, I'm not saying that we are doing it intentionally. Many of us are not aware what is the importance of citing our own journal. We are not aware. If we actually see this data, we have this realization. Let us, we put hours into writing a manuscript of ours for writing in a good journal. Can we give 2 hours of scanning of IJRH archives, doing a research or search within the IJRH website to see whether you have a citable paper? And I think this is something that we can start doing this intentionally and very conscience friendly, in a very conscious friendly way. So SJR just doesn't ask how many people. I just can't manage these many. I'll keep this here. SJR just doesn't ask how many people are talking about you. It asks who is talking about you. Impact factor would only ask how many people. Blog and Lancet, same thing. Here, SJR would ask who is talking about you, not just how many are talking about you. So this is a comparison of homeopathy journals again. Oh God, this has to be edited, wait. I don't know why is it showing like this. One moment, please, bear with me. I won't take long, but then I think this is important. This is a very interesting comparison again, so I would not want to let this pass like have seen. Yes. I think we can simply go with the decreasing the font size, no? A little strain on your eyes would do, I guess.
It's not decreasing the font size, you will have to change dimension.
I think it does. It works. Okay. Right, so this is a comparison. Let's just see. Homeopathy thema is SGR is 0.40, 0.43. Quartile 2 I don't know why this slide has not come. It would come eventually. Quartile 1 means that you are in the top 90% of scores of the paper, of the journal scoring, the top 90%. And this is like the global flagship journal. So this is where you have top 50% of the CAM category. Consistently, homeopathy is in top 50%. And then IGRH has a score of this, 0.2 to 0.43. Q3, India's premier research organization, CCRH. The score has fluctuated a little, but stays a solid choice for clinical and drug proving research. And also we have, so this is basically what is the basic research that we are printing. We are kind of publishing more of clinical research work and drug proving research work. So this is where the score is coming out from. And homeopathic links, again, you can see it's in the bottom 25%. It's a Q4 journal. And this is news. Even IGHDR has a lesser score of SJR and remains Q4. Now, does not have impact factor, is just 0.15 and remains Q4, and somehow comes even below links. So links is basically not scopusing. This is again an arbitrary scoring that has happened. But I just wanted to see how this is happening. So you can see, the comparison and how it all changes this perception when you see at the metrics. Our perception is just hearsay of what we have kind of intelligently built based on what we know, but the figures would have different story to tell sometimes. Now here, let's see this. It's again very interesting. I did a comparison of IGMR and IGRH since yesterday was a lot of IGMR that we talked about, so I thought, let me see. So this is an unnormalized impact. So this is the journal impact factor citation count, where IGMR is seen to have 2.7, IGRH is at 0.7. This is again, we do not have an impact factor, an arbitrary factor that we have. And look what happens when we come to normalization. I'm not ashamed suddenly.
We are happy.
We are happy. Yes. Look at this. Now, I would come to the interpretation of this also. So this is the power of normalization. And in sectors, I would again, insist on this. In sectors, and it's not only homeopathy. It's about all the sectors that do not have that much of research going on. Talk about medical research. It's all pharma funded. They have huge research going on. Maybe 90% of the research that they're producing is about the drugs, about new drugs, but they still count in that sector. Maybe it's only 5%, 10% where they're making new discoveries. But then, ma'am, with no offense, but then the fact remains that they are doing that much of research. Homeopathy is a very niche sector. Unless you do some normalization, how do you get the scoring? So I don't really think IF would be the right measure for us. Now let's see. The unnormalized impact. This chart displays the journal impact factor, the gap. IGMR appears significantly more impactful than IGRH. In this view, IGMR is seen to be over 4 times more powerful in the academic landscape. 4 times more powerful. Reason, general medicine covers a vast range of high-frequency topics. They talk about COVID, diabetes, infectious diseases. Do we also not talk about it? We do, but at the same rate, in the same frequency, by the same citable authors? No. Attaching a huge pool of citing authors. Okay? Homeopathy is a much smaller field with fewer active journals and citing researchers. Active journals, how many do we have? Citing researchers, how many do we have? In fact, my experience in IGRH editing would say, sometimes it's so obvious that, the manuscript should be citing a very obvious work that everybody in homeopathy knows of, and that statement comes to us without citation. I'm not saying wrong citation or a weak citation. It comes without citation. It comes as if it's their own opinion, while you would have made such a strong point by putting a citation to it. So sometimes we absolutely don't feel the need of citing things that we know that is very recent development in homeopathy or recent publication in homeopathy. sometimes it was unintentional, but sometimes I do get shocked at the bliss of ignorance that we are feeling, you know. Now, what happens when we do the normalization? This chart displays the SNP, source, normalized impact per paper. Sorry, I didn't remember the whole name, so I was not naming it. It's source, normalized impact per paper. The convergence, once the data is normalized for its field, the gap between the two journals shrink considerably. Right? IGMR is at 1.15. This score indicates that IGMR is performing slightly above the world average, 15% better. So 1 is considered the world average. It's the global average, and so it is just performing 15% better for its discipline, and the IGRH is performing at 74% of its field citation potential. So if it's an average, global average is 1, we are still doing 74% of that. So this is our field citation potential. So the reality check is that while IGMR is a heavyweight in the raw counts, IGRH is surprisingly competitive when you consider its rich niche context. It isn't 4 times worse. Let's understand. If the impact factor says we are 4 times worse, we aren't. It isn't 4 times worse than IGMR. It is simply operating in a field with 1/4 the citation inflation. We are just operating in a different field. So we are trying to compare apples with oranges, which we should definitely and most intelligibly avoid. Google Scholar Journal Metrics, basically it has an H5 index that we talk of, and it uses its own index databases, huge but opaque. But it's very diverse. The H5 index is very diverse, and I have seen most of our, I think, consul scientists also, it's struggling with correcting Google Scholar indices. Many papers would make an entry into it, and you have to go to your, for your scientist, scoring also, you have to correct so much of crap that comes in. I don't know how. Similar thing happens with the journal here. So even though there's a median that they apply, but then again, it's not the best of metrics to apply to the journal like ours. Very interesting now, the shift from journal metrics to article metrics to alt metrics that we talk about. This is taking the focus away from journal to the article per se. Even if you are published in best of journal, or you have published in worst of journals, what is your article per se telling about the paper, and how is that metrics affecting the journal or affecting you as a scientist is also some things that the science has realized needs to be measured, and that is done by alt metrics. The key point, a good article can be published in a low prestige journal and a weak article can be published in a high prestige journal. Evaluate the research itself, not just where it was published. That is the goal of alt metrics. Maybe, sometimes the best of work, because of the ignorance of the author, gets published in a lowly journal. Doesn't mean that the work is not good enough. And sometimes there would be reasons why a lowly work would be published in the best of journals. So this is what is going to come across as alt metrics. What are they? The measuring of online attention that a research item receives separate from scholarly citations. So here, please mind, we're not talking about scholarly citations. Till now, we were talking about citations and its normalization through impact factor, through SNP, through SJR. Here, we are talking about purely journal metrics and not scholarly citations. We're talking about the research item per se. Goal, capture the social, economic, and political reach of research in real time. We are all very poor at it, including me. I think I'm even worse than many people, but we are very poor at it. We just don't know how to cash in on our paper. Like ma'am was also telling that, you should cash in on that paper, but then we just don't know. And so we need sensitization on that. We need capacity building on that. People are talking about their papers, and people are getting citations. People are getting a lot of popularity because of that. And we just publish, and we're happy. And we're happy to report to Dr. Harleen ko in the end of my monthly DO summary. Dr. Harleen, we were able to publish Yellow Dal do Bhejwa Ministry mein. And I think our job is done. That is, after publication, a new job begins. The job type changes. The job doesn't end there. It is not at all right at this stage and juncture that we as homeopathy researchers are to shy away from publicizing your work. If you know your work is good, please make some noise about it. Please don't sleep over it, because nobody would know your work is good. I mean, in fact, one work that has got very popular might be overshadowed by a lot of 9-10 other works of counsel which is not that popular, but it didn't make noise. And that one work might have got internationally noted because they were like, oh, this is the only person who is working. Right, which is not the case. They just kind of play the cards right. So that is what the attitude towards altmetrics need to be developed. Attitude and aptitude for altmetrics is the order of the day. So these colors that you see, they actually have a meaning. The blue is, it says how much policy documents have been used, have been inspired from your work, how much your work has been covered in news, how much your work has been covered in blogs. So it's a mix, it's a platter. Altmetrics is a platter. So everything that, so like we were talking about citable documents, and then we were talking about documents. Now we're talking about something beyond documents and also documents. We're talking about everything that is not research paper, but everything else. So here, there's something that, you know, news, blogs, Twitter, X, YouTube, patents, Wikipedia, Facebook. And the moment you post your paper on Facebook, the Plumx metrics, you can't wish it away. If you have a DOI and you post it in social media, you are already contributing to your altmetrics, knowingly or unknowingly. So it's like, you know, it's a different topic. It's a little tangential, but I just want to still mention because it's again my pain point. It's like you wish or you don't wish, you have a Scopus profile. You have a Scopus profile because you publish in a Scopus Index journal, knowingly or unknowingly. Your principal author did know that. Maybe he knew and you did not know. You have a Scopus profile. Now, if you choose not to correct your Scopus profile, it is bringing you down, it is bringing the council down, it is bringing the whole homeopathy research down. So we have to own up to our profiles. Similarly, the moment you post in the social media, you are contributing. So you can't say, you know, I am not the social media types. Nobody is asking you to go out there and say, hi guys, how are you? No. But let your paper do that. Hi guys, how are you? Let your paper do that. Your paper needs to speak, but at least show it so that it can speak. Right. Interpreting altmetrics, there are pros and cons to it. Speed, immediate feedback, not years. We were talking about 4-year span. Here, this is where we're all on the same page. If you can get an influencer to talk about your paper, maybe your paper will have a better plummetrics or an altmetrics than a Lancet paper. It's just about the game. I hate that. All right. Yeah. But I have been giving him these deadlines. I'm sure he was waiting for this moment where he can give me a deadline. So he's getting back to me, I know. I'll settle the score with him later. Anyway, so reach shows impact beyond academia. Granularity, article, data set or software level, everything goes in. Cons, fragility, easy to game. Sometimes they are fake accounts, sometimes they are fake reports. Sometimes somebody else would own your paper and say it's yours, it's theirs. Bias, trending topics get more attention than foundational research. So they could be trending topics. So in case you happen to be at the right time to reporting about this, the trending condition, don't miss the opportunity. Report about your paper because the topic is trending. Sentiment, a high score might mean a paper is notorious for being wrong. That could also be the case. If there's a lot of news report about your paper, maybe it's the wrong noise. So, but the altmetrics is up, so that could also be the con. This is honestly, AI generated, won't tell you the source. I don't know how, this could be wrong, but I don't think this is overall wrong. I just wanted to see.
plain curious and just sharing with you, how would an IGRH altmetrics saying today? Because with digital commons indexing, we do have our Plumex. So we do have altmetrics drainage that is happening. So this looked very practical to me. See, we are being reported 15% in the policy and guideline citations, Facebook engagement only 10%. It's to be blamed to me because I don't post a lot of articles on Facebook. We should be doing that. And news and media coverage 25%, and blogs and summaries again, and then other shared resources 15%. So. Citations versus altmetrics, too smaller font, I'm sorry, but then, of course, I think we all know now speed is slow, is fast, audience academic, broad audience, data source structured, web and social media, indicates scholarly impact, social reach, primary tool is GIF, H-index, altmetric donut. That is the altmetric donut, by the way, I forgot to mention it. The donut that you saw, the multicolored donut, which you would all love to have, is basically an altmetric donut. Responsible use of metrics. The core dilemma, good measures can easily be abused. So, never use metrics to replace peer review or quality judgment. Right? So, if your paper has undergone some peer review in a journal, don't just think that, my paper is going to, is published in so-and-so journal, or I have submitted to so-and-so journal, so I don't think that there's a need for a peer review or a comment from an expert. They're always going to, be a better resource to comment on your paper, and then use a comprehensive, balanced portfolio of metrics. So it's not that you would see that, a journal has a very good altmetrics, but a very poor SNP or an SJR or a, and you would still, or a side score, and you would still want to publish in it. It's not like that. So push for reform. It's very interesting to see that San Francisco DORA, this is DORA, Declaration on Research Assessment, a major worldwide initiative signed by thousands of institutions, pushed for advocating that JIF must not be used. This is not coming from homeopaths. We are not saying that. It is the DORA saying that JIF should not be used as a proxy measure for the quality of individual research papers or in hiring or promotion decisions that we are talking about. So this was, again, this is a common voice that is coming from the scientific community. Future directions, metrics provide useful proxies but require understanding their context, limitations, and underlying data. The movement is shifting from journal to article assessment, like we discussed. The future researchers have to open up to machine learning. Let's all face it. You can't wish it away. Machine learning, AI, altmetrics is all for you. You can't wish it away. Open metrics, integration of societal impact indicators. You all know that. I'm not teaching you anything here. Everybody knows it. We are IGRH. This is a QR score. Probably the clinicians at the back. This is a QR score for, QR scan for IGRH if you want to know more about the journal. And this is how what all we publish. And we are on Editorial Manager, which is world's #1 management system for journals. And you see that, interestingly, what I was talking about is a Plumex. These are the altmetrics that you can see. These are the downloading. We have heavy downloads, so it's not in the air. IGRH is getting there. Join the movement and support IGRH. So I guess embrace change, lead the future. The publication world is shifting, and those who adapt and ethically innovate will be the ones to lead the way. Strive not to be a success, but rather to be of value. Thank you.
May I now please welcome Dr. K.C. Muralidharan, Assistant Director, Homeopathy, and Dr. Santosh Tamang, Officer in Charge, CRU, to kindly felicitate Dr. Harleen Kaur for her wonderful presentation. Yes, sure.
So anyway, a wonderful session from our own officer. So, but I would like to say a few things. Yesterday we have posted our today's program in the X. Okay, how many of them have seen this?
I've seen it.
How many of them have liked it? Only 2 people. Myself, Dr. Hurley. So this is the stage of our usage in social media. So we don't want to use the social media for a wrong purpose, but whatever I think various institutes are posting their own activities in the Facebook. How many institutes are supporting other institute? Very few. I always like it.
Yeah.
I always like all the institute activities Facebook. But if you are doing the same thing, our visibility will be more. So you support mutually with all the institute, whether it is NHRIMH, whether CRU Patna is doing. I think almost all the institute are having a Facebook account in our own. So you should do it. Whatever, maybe it is disagreeable to you. Some activities may not be like it. Oh, they will be thinking what they are doing it. But they are doing from their capacity within that environment constraints. They are doing all those activities. It has to be popularized. So my request is that those who are not how many of are having X account? Only very few, I think. So all should take X account, because now the scientific deliberations is happening, LinkedIn also, happening in X, because whatever we are getting, the skeptics are more active in X account. So whatever they are posting, and simply we are clicking it on, and they are getting maximum visibility. Instead of that, you should not share those links to the people by clicking those links. Instead, you take a screenshot and share with the other people. Yeah. So that will reduce the visibility and accessibility of that particular account. Because especially we know that I am from Kerala. Basically, there is one person is active on anti-homeopathy, which doesn't have any, I think, any stand for that. But you should not access those links. But instead, you should take the screenshot and share with that. That is sufficient. And if it is any videos, then somebody else should download it. Don't try to download all the people. And if it is one person is downloading and sharing with that within the closed group, not with the public domain. So these are the few things. And another things to get more visibility on IGRH also, we should plan some policy document to be published. Yes. So this policy document will be having a more reachability in international arena. Sure. So that is the first thing. Right. Second thing actually related to the articles. So when we trying to publish in other journals, so you can publish in our own journal also, so that our visibility also will be more, and you should publicize it. And yesterday also I was discussing with Dr. Herlin also, we will start some podcast, because yesterday we got that idea from Dr. Albina. So we should start, our own officers should start some, I think she will take the lead of that proposals further ahead. So with these words, congratulating Dr. Herlin once again, because we are not in lower level, we are in higher level always. Okay, IGRH is in a very higher level, so we will be publishing more good articles and journal articles also. I think we should promote some journal articles which is relevant to the common people.
Review papers.
Yeah, review paper and some population studies.
Short commentaries.
Yeah, so that type of things which is not relevant to homeopathy but relevant to the common public, so that the government can take some policy decision on that. Right. So that is also has to be considered in our journal. Right. Thank you.
Thank you, sir. Thank you.
So big round of applause for Dr. Harleen Kaur. Sir, felicitating her with the khada, a traditional Sikkim attire.
Put Photographer कहाँ गया? Photographer.
Police photographer.
हाँ. Just to the call the photographer.
Call the photographer, please.
Don't take now. I'm holding like this. Photographer चलेगी.
I think we have delayed the lunch by 15 minutes. Probably he's coming.
Photographer is very particular.
1 p.m. means 1 p.m. I'm sorry, I overrode on you. No, that's okay, ma'am.
कहाँ बचा?
I finished all my slides. There was nothing.
Hina. चलो बोलो.
I took about 5-10 minutes for session. I was only rather busy. Otherwise, everything is running.
Let me there. You give
Yes.
once more.
Thank you so much. Thank you, everyone. So I guess we are now breaking for lunch. Lunch is ready. Right. So we are resuming at 2 p.m. So yeah, we will have our So we will have our last session from 2 to 3:30 p.m. We are